Pandemic Task Force. Thank you so much for being here on short notice. We really appreciate your taking the time to be here today. Start by reminding everyone to please go into the chat and see if there's a link there for you to mark your attendance. Appreciate you doing that. And the next item of business is approval of the minutes. So hopefully everyone had a chance to look over the minutes from our last meeting. Do we have a motion to approve the minutes? You can just do that verbally if someone would provide that motion.
Cindy, I make a motion to approve the minutes.
Thank you, Joe. We have a second?
Second to approve the minutes.
Thank you. Thank you. Was that Heather?
Yes.
Okay, thank you. Thank you. Okay, all who agree to approve the minutes, please say aye.
Aye.
Opposed? None? Okay, thank you. With that, the motion passes. Just a quick reminder of our purpose, which is to provide information and advisement to the superintendent on the task of reopening and continuing the operation of schools during a global pandemic. As you know, things are changing very rapidly, and so you have taken on quite a task. With that, I'm going to turn it over to Dr. Atkins for a few words. Thank you, Dr. Atkins.
All right, thank you, Cindy, and I'll just echo some of what you said there. Welcome, everyone, and I do appreciate you joining us on such a short notice. It is very important because, as was mentioned, this is a very fluid situation, so things are constantly changing, so we do need to come back to you and appreciate the short notice that you've been able to respond to us quickly, because we do have some new updates and some decisions that we need to make as a committee prior to us actually moving forward tomorrow and providing our board with additional information in a workshop. We did receive an executive order from the Commissioner Corcoran just yesterday, and I'm going to go over some of that in just a minute. But what we are trying to do here is really provide a really high quality education for our students, and one that gives equitable opportunity, closes achievement gaps, and does that in an environment that's safe for our employees and also safe for our students and families. I think also, though, I'm really proud of the work that our team has been doing, both through the input that we've received from our administrators, our teachers, our employee unions and associations, and then also, of course, this task force. We have really put together a document, or the team has, that's pretty comprehensive, but something that we continue to work on. And then, we'll talk about next actions at the conclusion of this meeting. I think you'll see, though, that this plan does provide our families some flexibility and some choices. So, there are going to be some options out there with what we're going to be presenting tonight. And I do feel really good about that. Before we get to some of those specifics, though, I do want to hit some of the highlights of the executive order. And if you see the first part right there, I think that really hits one of the most important things. And that is that all schools, upon reopening in August, all school boards and charters, school governing boards must open brick and mortar schools at least 5 days per week for all students. And that's, of course, subject to the advice and orders of the Florida Department of Health and our local departments of health. But that's very important. And what's very specific here in this order is that the schools are expected to be open and provide families an option for their students, should they choose that option, to attend school 5 days a week in a brick and mortar setting. So that, of course, is going to have an impact on our plans, which we'll talk a little bit more about tonight. There are some potentials for some latitude as it relates to this plan. But there right now is not a lot of specifics regarding that. And let me give you an example. Requiring the section of the statute that requires local school districts to establish a uniform and fixed date for the opening and closing of school is waived to the extent necessary to give an effect to this order. So there is a possibility of adjusting, like let's say a start date. That is something that we are evaluating, but we're not making a recommendation to you to change our date at this time. But that is something that is under consideration. We have also looked at what other school districts are doing. Most of the ones that we've looked at are staying consistent with their current date, but there is a little bit of differences in when those start dates actually are. The other piece in the statute that does provide a little bit of latitude is this part about 180 days or the hourly equivalent. But all of this is contingent upon whatever plan that we actually put together. We must submit that plan to the state of Florida, to the Department of Education, and that plan must be approved by the Department of Education because there are laws and statutes and requirements that we must adhere to, and so they are making sure that we are adhering to those requirements. Something else in terms of an expectation is that we provide the full services to our students as we move forward. So that full array of students that our services as we're required by law to provide our families and provide our students, that is an expectation that will continue. And that, so for example, if we have a student that has an IEP and there's services that are provided under that IEP, it's an expectation that would continue. Now, there is an opportunity for us to do, what's called innovative teaching methods that provide support for our students if they want to do that in an alternative setting. We'll be talking about that tonight. But what's also important is there's an expectation that those students, if they're in that type of environment, we're going to be progress monitoring those students as well as students that are in a brick and mortar setting. And if we see any evidence that students that are not in that brick and mortar setting are not making the progress that they need to, then we have to have a plan for that. So that just gives you some of the examples, in terms of what we're going to be required to do. The executive order is something I would encourage you to take a look at. What's important is whatever plan we put together must adhere to the requirements that are in statute, and it is something that we will be submitting to the Department of Education. We have until, I believe, July 31st to do that. And of course, this is making sure we have a plan that is approved is very, very important for us to secure the funding that we need and the support that we need from the Department of Education. So that's all I'm going to have about that plan. I think the most important thing that we will have to address is that this executive or emergency order does impact the recommendation that we had made the last time we came together, specifically around our hybrid model. I do feel good about the options that we're going to be presenting this evening in terms of what we can do to help support students, because what we know is that our families want flexibility. There are families that want to come back to school full time. They want their students there 5 days a week. And then there are other families that are just not comfortable with that. And so they feel more comfortable with a virtual option. And I think tonight you're going to see the team has provided that. And then, I appreciate the work of the instructional model subcommittee. They put a lot of work into this and have given us a real good recommendation. So I'll look forward to discussion around that issue. So that's all for me in terms of the welcome. Looking forward to the meeting. Again, thanks for everybody being here. Cindy?
Thank you, Dr. Atkins. So we have quite a few things to do tonight. As Dr. Atkins said, we're going to be looking at some updated recommendations. We'll talk to you about how we're going to go about that process. You're going to hear from Dr. Spiro and from Dr. Savage about some updated recommendations around instructional model and around some health and safety precautions. We're going to listen to all of those recommendations first, as we did the last time. Then we'll go back and review the recommendations, have a discussion around that, and then we'll take a vote when that is finished. So with that, I'm going to turn it over to Dr. Spiro, and he's going to talk about some recommendations around instructional continuity.
Thank you very much, Cindy, and thank you very much, Dr. Atkins. This evening, I'm going to be sharing with you an additional model that we're asking the task force to consider. This model was presented to the Instructional Continuity Subcommittee last night, and it did pass the subcommittee with unanimous, complete consensus. So I'm the voice of the subcommittee, and so I'm going to talk to you about what that model looks like. So the model that we would like to present to you is a model that we're calling Lee Home Connect. And this option is an addition to the virtual option that was already approved by the task force. If you remember the last task force meeting, we said that students that did not feel comfortable about returning back to school full-time had the option of going to the Lee Virtual School, where they would still have their seat held at their regular home school, and then they could go for the Lee Virtual for at least one semester. So what I'm going to talk to you about is an addition to the Lee Virtual option. This is an option that provides one more virtual opportunity for families, but keeps the student connected to their school. So the goal around this one option, that's why we call it Lee Home Connect, is because it keeps the student connected with either a teacher in their building or their assigned classroom teacher. So I'm going to break up the example by using a K through 5 example and then the 6 through 12 example. So first, let me talk to you about the K through 5 example. So this is for a student whose parent is not interested in the student coming back face-to-face right now. So the school would identify teachers who would be teaching solely full-time through a virtual platform. So you would have a teacher at each grade level, or you may have multiple teachers at each grade level, depending upon what the numbers are for each individual school. And those K through 5 teachers then would provide virtual synchronous instruction, live instruction with their students throughout the course of the day. This then keeps that student connected to the school, and they are taught by a teacher within that school. And then when that parent is ready to come back to a regular school setting, they simply come back to the school that they're already assigned to. What the subcommittee talked about last night was that students should remain in the Lee Home Connect program for at least a quarter, or unless there are some family issues that are unique, it might be a job issue, it might be a health issue, whatever those issues are, then those families would work with the school-based principal to determine if they could come back into the regular school prior to that 9 weeks being up. For 6 through 12, instead of having the pool of teachers, so in elementary is a pool of teachers that were identified to teach virtual all day long, 6 through 12, it'll be different. These will be the teachers that are already assigned to a student. So I'll use high school as an example. So high school has the block scheduling. Students take 8 periods a day, but as a teacher, I teach 7 out of 8. So my schedule as a high school teacher, for example, I would have seven periods, but I might have 5 of those periods might be with just my students that are doing face-to-face instruction for me, and I might have the other 2 periods be where all of my virtual students that are assigned to me, they're assigned to me exclusively in those virtual classes. So the assistant principals for curriculum at the middle school and high schools would do their best to try to manipulate teachers' schedules so that all the virtual students would try to be assigned to those teachers at one time. In a worst case scenario, you would still might have some students that are doing face-to-face, but then with a low number of students. The goal would be certainly to try to be as many virtual students assigned to one teacher at one time, so the teacher is not having to balance between doing face-to-face instruction and also at the same time trying to monitor the online platform. That's going to be the overarching goal. Could there be a case where a teacher might have to do some face-to-face and a few of the online instruction? Yes, but that would have to be depending upon the school, the number of students that are enrolled into the Lee Home Connect program. So now I'm a student enrolled into this Lee Home Connect program in grades 6 through 12. I have one of those teachers, and I decide I'm ready to come back to school face-to-face. So now there's no need for a student to get a new schedule. They're going to go simply face-to-face to those classes where they already had that teacher. They know the teacher. They know the procedures in the classroom. They're right on track with the content, so there's no gap in the learning as well, so that instruction moves forward. It just moves now. I went from home to now I'm going face-to-face right back at that school. So I have that sense of the school community. I have that continuity in the building as well, so that I make sure I make sure that I'm making those connections with my schools. So that is the model, Cindy, that we would like to propose. It's an additional model to the Leave Virtual. And if you want to go ahead and move on to the next slide. So I want to remind you then, what does this look like? And this is a little graphic now that talks about all of the models that we will have available for families. So as Dr. Atkins talked to you about the executive order from the chancellor, from the commissioner of education that came through, that would really negate the hybrid model that we approved at the last meeting. So the last meeting, we had talked about a hybrid model where students would come on Monday and Tuesday, everybody would be home on Wednesday, and then Thursday and Friday, a different group would come in. This now would negate the need to do that hybrid model because students would have a variety of options. They could come face-to-face if that's what the families want. They come face-to-face. They could do the Lee Home Connect, where they're connected to a school, and they're connected to or very specific teachers in that school, or they could do the Leave Virtual option. And we've already had a lot of families take advantage of that option. Or a family could decide to do, you know what, I'm just going to go ahead and enroll my child in homeschool and take care of their education through that avenue as well. One more slide, Cindy. And just as we talked at the last task force meeting that was approved, at any time, we could always revert back to the distance learning platform. So if a class may be shut down for a reason, if a school has to be shut down, or we work with our local health officials, and it's determined that based on the numbers in our community around bed occupancy and the Lee Health and the Department of Health says we need to support, that we're going to have to switch to distance learning, we always have that availability as well. So that's really a fifth model that we have at our disposal that we already approved at the last task force. And I just wanted to remind everybody that was an option that was still there also. So that's the reopening plan that we'd like to present to you based around the Instructional Continuity Subcommittee. Thank you, Cindy.
Thank you, Dr. Spiro. So you've heard the recommendations that are going to be coming forward for instructional model, and now we're going to move over to Dr. Savage, who's going to talk to us a little bit about transportation and some changes in that recommendation. Dr. Savage.
Thank you, Cindy. We don't have that many adjustments to the transportation, but there is a pretty significant one, and so we just wanted to take this and bring it to you today. If you could advance to the next slide. The big issue is in the area of masks or facial coverings, and this has had considerable debate, not just in school districts, but really across all the various counties and municipal interests across the whole state of Florida. So because this is such a divisive topic, we wanted to just kind of summarize it. In the prior recommendation that we had brought forward to from our subcommittee, we really did not have a consensus on a recommendation relating to masks other than our current status as a district was recommending masks. But after considerable and lengthy dialogue with health professionals, reviewing all the health recommendations that have been coming out from various sources, as well as what other districts are doing across the state in terms of this specific area, the area of transportation is unique in that we really acknowledge our inability to socially distance to a level that is recommended by the CDC or even any of our medical professionals, where they really want us to try to get to 6 feet, and that is just not feasible in transportation. And when that is not feasible, then masks are expected to be worn, and that is really the change in stances. Rather than just recommending masks, which is it sounds like just an advisement, something that is nice to have. We really, due to our stance of wanting the safety of students, their families, and our workers, if we're going to put everyone in this close proximity situation, then it is vital that we really prioritize the safety of our students, their families, some of which may have vulnerable family members, and then workers, of course, knowing that students can be asymptomatic transmitters of the virus, and knowing that you might not find out until it's too late. That's just a heavy burden to carry. And so because of this transportation and really relying heavily on the medical advisement from both the CDC, American Association of Pediatrics, as well as many other health recommendations, masks will be expected to be worn on the school bus. Again, for families that simply do not have the means to provide that for their children, we certainly will have that available for them. And we will have protocols in place for families that take an adverse stance to that position as well. We'll have protocols and things developed along those lines. But we just felt that this was too important of an issue to take a passive stance, that we needed to take a little bit more of an assertive stance in this respect. Now, just if you'll advance to the next slide. One additional update is just that as we've analyzed the numbers that we anticipate returning in our bus routes, we are anticipating that we may have target routes of anywhere from 20 to 40 students. Now, again, we're not bound to these numbers. They may go over that number, but based on projections, that is the kind of number that we would be looking at, which means we will try to do the very best we can to also have some level of distancing to enhance the mask expectation. And we will make every effort to be very strategic in that, including things such as seating students with students who are at the same bus stops and other procedures to really try to maximize the safety in what is otherwise a pretty condensed space. So that's the big adjustment in transportation that we have that I'm bringing forward today.
Thanks, Dr. Savage. And Cindy, if you would advance one more. So just like Dr. Savage talked about with the rationale for having the expectation for masks on buses, we're also going to say in the schoolhouse as well, we would like to have masks are expected to be worn during those large gatherings, such as transitions in the hallway, going to the cafeteria, leaving the cafeteria, gymnasium. So those opportunities during the day where large students would cross and intersect, we are asking for the task force to consider that masks are expected to be worn during those times as well. Thank you, Cindy.
Thank you, Dr. Spiro. So now we're going to move forward for recommendations from the task force. So the way we are going to do this is look at each recommendation separately. Then I'll ask for a motion and a second to approve the recommendation. That will lead us into a discussion. And then we're going to change our voting process a little bit this time. The last time we had difficulty using the little blue hands. And when we went back and looked, there were many members who we did not have a vote for either way. So we're going to do a roll call vote this time. That way we're sure whether or not you're supposed to vote, and we're sure which way you did vote. So we'll change that process just a little bit. So first thing that we'll talk about is the homeschool connection option. And you recall that as Dr. Spiro described that, a student will be paired with a teacher from their school, and they will be working from home full-time on virtual learning. If they choose to come back, we ask them to wait 9 weeks to sign up for or till the end of the quarter. So if they sign up at the very beginning of the quarter, they would be in that program for a minimum of 9 weeks, unless there was a special circumstance, in which case they could go to their principal. The parent can discuss that, and at principal discretion, they can move back in at any time. If they start 3 weeks in, then at the end of the quarter, again, they would have that chance to go back. So do I have a motion to approve this recommendation for adding the home connection option?
Cindy, this is Harlan. I'll move to approve.
Thank you, Harlan. Do I have a second?
I second it.
Thank you, Jackie. So we will now move to discussion. If you go to your participant, down at the bottom of your screen, if you roll over, you'll see participant, and you'll see 3 little dots. And if you click on those 3 little dots, then you will see a little thing that says raise hand. That's going to put your little blue hand up. So I will take them in order based on those hands. And if you do have difficulty with that, let me know, and we will work on and making sure that you get your turn to speak. The first hand that I see is Samantha. I'm going to stop sharing now so that we can see the person who's speaking. Samantha Howard.
Hi, Cindy, thank you. I've got a question about the students who are in the Lee Home Connect. Will they be provided the technology resources that they'll need in order to participate in that?
Great question, Samantha. And yes, they would be provided all the resources that they would need. And Trey Davis is on the call here, and I don't know if Trey would like to elaborate on that if he wanted to, but absolutely hotspots, and then certainly, the Chromebooks that are available. Trey?
Dr. Spiro, he's trying to log back in now.
Okay, that's fine. Cindy, you can move along then.
Okay, we'll go ahead then. Then our next speaker, is Kevin Daly.
Thanks, Cindy. And Dr. Spiro, you can just nod. You don't have to speak, as I'm going to ask kind of a series of questions. Again, you stated this replaces the hybrid model, right, that we agreed to last time? All right, and then I guess my next question, and again, I've expressed this times, a lot of my issues deal with the vagueness of we're establishing a framework, as with everything, the devil's in the details. And so I'm just concerned about those teachers, like if I'm a kindergarten teacher and I'm assigned to be the person who deals with the kids who want to do the Lee Home Connect, am I still reporting to work every day? And am I essentially locking for 7 hours from the school? And secondarily, if I'm in a vulnerable population, and that's the reason I was assigned to Lee Home Connect, am I expected to live stream from my house every day for 7 hours?
So I can answer that, and I let Dr. Pruitt jump in as well, because it's really a human resources type question as well. So our goal with this particular model was also at first to take care of our vulnerable populations, to make sure that people are working and making sure that people are also servicing the students that we need to. Dr. Pruitt, anything you want to add on that?
I think just to Kevin's point about the framework and then the execution, it will definitely be a very, I'll equate it to like having a puzzle and trying to figure that out. In other words, if I have the best scenario would be to match up those vulnerable teachers with those students at home, and then work through then what the expectation would be reference to the instructional model, because I do see the concern there relative to that. But we want to certainly keep students at the focus of our decisions, but we also, and important as well, is trying to do what's best for our employees and the folks that are going to be actually doing that work. And so some of those questions we're just not going to be able to answer until we know the numbers, until we know how many students actually sign up for what option and how many teachers. We do have some preliminary information, but again, we won't know until we actually pull that lever.
Thank you, Dr. Pruitt and Dr. Spiro on that one. Our next speaker is Mrs. Vaughn.
Oh, okay. Lost the pictures on there, but can you hear me? Hello?
Yes, we can hear you.
Oh, okay. Yeah, I had a few questions about the Home Connect. All right, the first one piggybacks off what was just asked. So the Home Connect teachers, whether it's elementary, middle, or high school, they're teaching from home? Their own homes?
Dr. Spiro, would you answer that?
Well,
I'll jump in and
Dr.
go ahead, Dr. Pruitt.
I was going to say, Ms. Vaughn, again, I think that depends on the workforce, and if we have staff that due to an underlying health condition or due to their age are not able to report to the work site, then it would be our hope that we could find a position for them, either through Lee Virtual School or through the Home Connect option. Again, we want to do our best to have everybody a working assignment that wishes to have one. but we won't know those details until we exactly see what our numbers look like. So in the short answer is, it could be both. It could be some teachers are working from home, and it could be some that are working from the schoolhouse.
Okay, the reason that I asked that is, how would those teachers have the technology in their homes that they would need? I mean, if you're teaching math, to put the math, I mean, will they have technology that they can demonstrate math problems, for instance, or that they can, our reading books, I believe, all have online components and little films as to introduce, and anticipatory sets and that sort of thing. Will they have access to those kinds of things if they're at home?
Well, they definitely would have access to all the resources that are available, for example, in OneDrive or Safari Montage, where a lot of our teachers use those resources. But Google, and when we use the Google Classroom, like Google Teams, it shows the same as the smart board as well. So teachers will have the capability of sharing their screens with teachers.
Okay, so similar to a smart board.
Yes, ma'am.
Okay,
and, I was going to see if Mr. Davis did he log back onto the line, because we've had some conversations about utilizing technology in this fashion. So I don't know, Daryl, did Trey get back on here?
Yes, sir.
Okay. And then, Ms. Vaughn, also remember all textbooks are also available online as well.
But, they're just some special things that they might have in the classroom. I had two other questions. First of all, the other thing is, okay, so let's say that, let's talk about high school now, since that's what I'm most familiar with. All right, so a student is Lee Home Connect, and that student happens to be a senior who's been involved in, let's say he goes to South Fort Myers and is in the auto shop there, has his own transportation or her own transportation. Would they have an option of doing all their classes at home, but coming in for just the one hands-on period? It could be they're in band or orchestra or something like that. Is that a possible option, or does that just make things too complicated?
No, the subcommittee did not talk about that as an option, but the reason we bring that to the task force today, it is to make recommendations and adjustments. And so if that's a recommendation of the task force, I think in a schoolhouse, I don't think I would be as challenging, other than, since Lee Home Connect would be a parent choice, other than the transportation to school, would have to be a parental piece.
Okay, and finally, would you run it by me again, what you said about the teachers, let's say in secondary, you said they'd be paired with teachers. How many classes would those teachers be doing?
Well, it all depends on the number of students in that school specifically, how many of those families would take advantage of a Lee Home Connect. So the example I just used an arbitrary example of a high school teacher that teaches 7 periods. I said in that one example, they might teach 5 face-to-face, and then maybe 2 of those are the Lee Home Connect students. And the reason for that example was we were going to try, with the APCs, we're going to try very hard to put all of the Lee Home Connect students together in one class to minimize the amount of face-to-face and then live teaching that the teachers would have to do simultaneously.
Okay, and I thought you said 7 out of 8. What happened to spending every day?
Right, I just use that as an example. So it could be 6 out of 8. You're right. It could be 6 out of 8.
Okay.
You're right.
Yeah, so if they did 7 out of 8, that would be a supplementary teacher, right?
We're not taking away planning for anybody. Let's be clear on that.
Yeah.
All right.
I want to make sure Mr. Daly heard that over there.
Dr. Spiro, don't cause problems, please.
Me?
No, Dr. Spiro.
Oh, well, my ears perked up as soon as I thought I'd heard correctly when he said 7 out of 8. And I'm like, oh, what happened to the 6 out of 8 for secondary? Okay, so I'm repeated it a second time just so we can be clear on that.
I'll use the example, thank you, make sure we have planning every day. So it really would be, it would be 6 out of 8. And so they would be teaching 4 of those could be, for example, all face-to-face, and then 2 could be with
I understood that. I just wanted to clarify this 7 out of 8. Thank you. That's it.
Thank you, Mrs. Vaughn. Our next speaker is Jamie Michael.
My question follows Samantha's, is that I heard from a lot of my folks that they had 3 kids and 1 Chromebook. If they stay at home, the kids, will they each have separate Chromebooks because they'll each have separate classes?
Mr. Davis, are you on the computer or are you on the call? Trey?
Yes, I am.
Okay. Did you hear that question?
So I just want to repeat, if I could, Jamie. So the question was, if you have maybe multiple family members in a household, and maybe they're sharing a Chromebook, or how would they access that? Did I get that correct?
Correct. If they're in 3 different grade levels, would they not need 3 Chromebooks with 3 different teachers, to be honest?
Yeah, well, first of all, let me kind of parse that up at the moment. So if they're secondary, of course, they already have issued one-to-one Chromebooks. At present, we have, Chromebooks issued for elementary school based on whether or not they have a sibling that's secondary, or whether they have access to a home computer, just purely based off of the inventory and, of course, supply chain challenges, at the moment with getting additional Chromebooks. And of course, then there's the cost aspect. But so at present, as you know, over the last few months, we've essentially had the one-to-one for all students. That's assuming, of course, that they had a sibling that had access to that system, or they had a home computer. So in cases where we may have a couple of different elementary school students, and let's just assume that they have different schedules and are not, actually on campus, then we would need to assess that. And some of that is principal discretion too, relative to whether or not they would actually need the Chromebook or not. So that's a great question, but just know that the digital divide is something, critically important to us, and we work to scale that to ensure that we're there. And I think I addressed in the last time, relative to hotspots, well, we've distributed about 5,000 hotspots, and we're in the 1% in the country that close that digital divide to ensure students and our instructional staff have what they need to teach our students at a distance. So hopefully that answers your question.
Thank you.
Thank you.
Our next speaker is Melissa Lehner.
Cindy, I think you keep missing Joe, if I'm reading that correctly.
Yeah, you're right, Dr. Atkins. It's Joe first.
Oh, thank you. Sorry, I had scrolled down too far. So I apologize, Joe. You can go next.
Thank you. So the question that I have with the Lee Home Connect, Dr. Spiro, is if you're an elementary teacher and you're doing the Home Connect instruction, is there going to be a class size capacity similar to if you had face-to-face instruction? Like if you're doing 3rd grade, would you be assigned 40 kids for Home Connect, where you wouldn't have that in face-to-face instruction? And how would specialist classes be addressed for Home Connect?
Thank you, Joe. First off, is my voice okay? I heard it was getting distorted.
You're okay now.
Okay, thank you very much. Right now, Joe, we're trying to figure out the class sizes. That was one of the pieces. There was a webinar right before we came onto the task force that was still going on when we left, to see what the commissioners guidance was around class size. So we just want to make sure that we're in compliance with what he wants as well. So that is a yet to be determined question on that one. In regard to the special area teachers for elementary school, the virtual teacher would do the integration of those special areas as well into their lesson. So if I'm that teacher, I'm home, I could be doing integration of the arts in there. You may ask students to keep a log of physical activity for PE as well. So we're going to have to look at some of those type of methodologies to make sure we're integrating all the way through in our curriculum.
Thank you, Dr. Spiro. Joe, did you have any other questions?
Yeah, actually just one, and I don't know if this is something that has to be discussed at another, venue, but the students who choose to do Home Connect, the families who have their children do the Lee Home Connect, would we still continue the grab and go food service program for those students?
Dr. Desamora, could you address that for us, please?
Yes, sure. So we, had continued to discuss and are planning for options to be able to serve meals to students who are not getting their education at the brick and mortar school. So we have to work with the Department of Education for the appropriate waivers, but we are working on a plan in order to make that happen. So we will have meals available for those students who may not be at their traditional school setting.
Thank you.
Any other questions, Joe?
No, that's it for now.
Okay, thank you. Okay, now Mrs. Weiner.
Thanks, Cindy. Jeff, this is for you. It's more of a comment than a question. As we're working through this, thinking about teachers possibly taking on other teachers' students, that we think about the focus issue and the grading issue, because that could become problematic for the teachers who are providing instruction to students that may not be theirs. The student is not assigned to their class. I just want to be very clear with my teachers and all teachers in the district as to how we report the grades.
So Melissa, maybe it wasn't clear because for middle school, they would be assigned to their regular classroom teacher. So that's the teacher that I'm Lee Home Connect middle school. I get my regular schedule. You would try to work your middle school teacher's schedule to allow them to have a couple, whatever periods are needed to have that exclusive Lee Home Connect period for all of their assigned students. So when I decided to come back, I'm just going to come back to that same schedule. I'm going to be working with those same teachers. So I'm not going to be assigned to any other different teachers. So the whole idea is to keep students connected with the school, keep students connected with their regularly assigned teachers. I'm just home doing that instruction because my parents made the choice to keep me home right now.
Great, that'll work much better. Thanks, Dr. Spiro.
Thanks, Melissa. Sorry that wasn't clear. Sorry about that.
That's okay.
Thank you. All right, and then our next speaker is Kevin Daly.
Yeah, sorry. I guess I'm the first of the seconds. So again, responding and thinking about, teachers who are who do the Lee Home Connect. I'm just concerned again about the manageability. We'll borrow a term from bargaining. The manageability of the Zoom platform. And I know I had a really successful meeting with about 800 people that luckily I was not in charge of. And they had Zoom set up to where the only people that could be seen were the people who were running the meeting. Everybody's cameras were turned off. Everybody was muted. They had like an email for you to send a question to, so you really didn't have to monitor the chat because that was turned off. And if you sent in a question, you were able to then turn on the person's camera and allow them access to speak. And then when it was over, it could go back to kind of only the person who's speaking is on the screen for everybody. Because I know, kids will be kids, and they'll inadvertently do crazy things. I remember early in the pandemic, we had a meeting, and even the teachers had a plan where we were going to like pass a carrot to each other through the meeting, and it didn't quite work out. But I think as we look forward to this Zoom thing, I think there needs to be some real consideration of a manageability of this. I mean, I'm glad we've gone away from a teacher having to be in person face-to-face and monitoring at the same time. That to me is a step in the right direction. That's a manageability nightmare. But I mean, even thinking of using the Zoom platform, setting it up so that teachers, so we don't get in a situation where somebody gets cyberbullied in a private chat that the teacher can't see, but when the transcript is printed out, it's all there. Or a student engages in inappropriate activity and the teacher really doesn't have any recourse other than to just throw them out of the class, which is not what we want. You can't, when you're virtual, you can't bring them out in the hallway and have that little 20-second discussion with them and say, hey, listen, this really isn't what we should be doing. Now let's get in there and kind of get back on task. So, I think if we move to this model, I think it's important and imperative that we kind of set the Zoom platforms, if that's what we're going to use, or any platform, up to be as successful as we can when we think about, the different environment of manageability. And again, the ideas of camera in the classroom is unsettling to me as a standard operating procedure, but the idea of a camera in somebody's house is even more unsettling. And I know I try not to be an alarmist, but I think there are opportunities there for people to record if they only put their cell phone up to the screen and record, or parents to record and then submit. And so, it's that whole platform and idea certainly is barely livable in the short term. So I definitely want to, when we talk about it, I want to be clear that, this idea won't be, well, Johnny's missing school for 2 days and, when we get back to normal, and the expectation is all of his teachers create a Zoom class that he can log into and live stream the class every day. That's not the new expectation, because, that's problematic. So that's all I got to say.
All right, thank you, Mr. Daly. Dr. Lee Master.
Hi, Cindy. Can you guys hear me okay?
Yes, we can hear you. Thank you.
So more of a comment. I joined a little late. Doctor's appointment ran a little late, but I definitely wanted to say a couple things. On Lee Home, the Lee Home Connect, I felt really good about it. Flexibility 2 and 4 families and kids in a different and challenging time. Allows tethering to schools, and kids get to keep that Manatee teacher, that Edgewood teacher, that tree line, whatever the school. And also, I personally like the flexibility for the workforce. I think it's really definitely a good step. Coming in a little bit late, I didn't have that opportunity. I really wanted to, as a principal, make sure I feel very positive about this and make sure I got that out there. And I want to piggyback on what Trey said. We had, as principals, I felt we had just wonderful discretion with regards to Chromebooks. When kids called us and families called us, we got computers to them. We realized that challenge when there's 3, 4, 5 kiddos in a family and there's 1 or 2 computers. So when I heard Trey say that, I wanted to make sure we got that out there too. And that's just a real credit to our bosses and our supervisors, because they say, do what you think is best. So again, not really questions, but just want to make sure I got those comments out there. It was a really good meeting we had yesterday. I was really happy with the plan that was presented. Thank you.
Thank you, Scott. Appreciate that. At this time, I do not see any additional hands raised. Does anyone else have a question or a comment? Joe.
Just wanted to ask a follow-up question to my earlier one. When Dr. Sparrow, you talked about teachers integrating the arts programs and the specials into their curriculum if they're Home Connect. Will teachers receive support to ensure, if they're doing Home Connect instruction, that if a student has an IEP, we're in compliance and it's being serviced? Because I could see that being problematic, perhaps, with our ESC and ELL population.
Yes, well, and so kind of 2 answers on that one. First, when the teachers are integrating the arts, they would do that also with consultation with the special area teachers to make sure that they're in alignment with that. And yes, services for any ESC student, making sure that their IEP goals were met, will be a part of the Lee Home Connect, and they will have the support from the school also, just like they would if it was in a brick and mortar. They would have that same support.
Thank you, Dr. Spiro. Any additional questions or comments? Okay, seeing none, I'm going to ask the question. We've already had a motion to approve the addition of the Lee School Connect model. I have to stop and think, it's been called several things over the last few days. The Lee School Connect model to the offerings that will be available to our families this fall. And as we mentioned before, to avoid the confusion around the voting, I'm going to do a roll call vote. So when I call your name, please tell me yes, no, or you abstain. And our first one is Yamasil Bermudez.
Yes.
Thank you. Marshall Bauer. I'm sorry, Marshall, I was looking down. Did you put a thumb up or down? A thumb up, thank you. Carl Burnside.
Yes.
Thank you. Joe Campaturo.
Yes.
Thank you. Brenda Clark. Ms. Clark, if you are on, if you could please answer verbally because I can't see all the faces at once. Okay, so I don't believe she is on.
Yes.
I'm here. Oh, there you are. Thank you. And is a yes vote? Ms. Clark, is that a yes vote, a no, or a no vote?
She just muted again. Yes. She just said yes.
Thank you. Kevin Daly. Kevin, is that a no vote?
Sorry, Cindy, you're right next to me on the screen, so I figured you could see me. It's a no vote. Just not enough details for me, so no.
Thank you. Isaac Dozier. I believe Mr. Dozier's on the call, but again, I can't see all of the pictures. So Mr. Dozier, if you're there, if you would please give a verbal vote.
He gives a thumbs up, Cindy.
Thank you. Is Captain Fields with us tonight?
Yes and yes.
Thank you. Marcus Goodson. Mr. Goodson on the call tonight.
Cindy, he was going to have to join late, so it doesn't appear that he's been able to join yet. He had a prior commitment.
Thank you. Brooklyn Gossett. I saw her. There you are.
Yes.
Yes, thank you. Angela Haas.
Yes.
Thank you. Jolene Harris.
Yes.
Thank you. Scott Hertz. Mr. Hertz on the call tonight. Okay. Don't hear him.
I don't see him, Cindy.
Thank you. Samantha Howard.
Yes.
Thank you. Melissa Lehner.
Yes.
Thank you. Scott Lee Master.
Yes.
Thank you. Jacqueline Lineberger.
Yes.
Thank you. Amy Jane McWilliam.
I am going to abstain because I came in about 30 minutes late, so I didn't get a chance to hear the whole presentation.
Thank you. And
Cindy, can you hear me?
yes.
Hey, it's Marcus Goodson. My vote is yes.
Oh, great. Thank you. Glad you're there.
Okay. All right.
Okay. And Ms. McWilliam, we will send out the presentation afterwards so that if you have any questions, please email and we'll be happy to answer those. Jamie Michael.
My vote is going to be with Kevin no because there's not enough fleshing out. I'm getting questions by email from teachers about different situations, and there's just a big concern about it. So my vote's going to be no with Kevin.
Okay, thank you, Jamie. Harlan Parrish.
Yes.
Thank you. Is Lieutenant Cleopo with us tonight? I don't believe I've seen him sign on. Dr. Saunders.
Hi, fine. My vote is yes.
Thank you. Shay Smith. I believe I saw her come on.
It was a thumb up.
There's a thumb.
Jay
Thank
Smith
you.
gave a thumb up on the virtual thumb up.
Thank you. Thank you. Sedona Stewart.
Yes.
Thank you. Mrs. Vaughn.
Yes.
Thank you. Crystal Verback.
Yes.
Thank you. And Heather Rodriguez Ribbles.
Yes.
Thank you very much. Okay. So let me do a quick count. So our count is 22 yes, 2 no, 1 abstention, and 2 people who were absent. So the vote does carry. Thank you. I'm going to share screen again for just a moment so you can see the next recommendation, which was around the masks on buses. Excuse me just a minute. So as you can see, the recommendation is that masks are expected to be worn in consistency with medical advisement. And then you can see the areas there. So this would be an expectation on buses, would be an expectation in hallways during transition times, and anytime students were in large gatherings such as coming into the school, dismissal, large gathering areas. Do I have a motion to approve this recommendation?
So moved. It's Betsy Vaughn.
Thank you, Betsy. Do I have a second?
Second.
I'll second.
I think I heard Jewel first, so thank you. I'm going to stop sharing again, and we'll go open this up for discussion at this time. The first hand I see is Jules.
Yes, ma'am. I had a question about the whole mask situation, expected versus required. Is there going to be some type of waiver signed? Is it going to be included in the code of conduct of what is expected? Because to me, expected sounds a little bit like a recommendation a little bit. And I know there are going to be people, just like we have kids break rules in school already. So is expected, does that mean required? Because you have to be careful about your choice of words because of the way people interpret things.
Yes, indeed. And Dr. Savage is our expert on expectation.
The expert on expectation, right? No, Joel, that's a great question, and it's a very common question across the whole state right now. And the 2 words that you've basically been heard in this, as it's been kind of framed as a binary, is either recommended or required. And some of the districts have required, and so some of the superintendents that we heard that where they are districts that publicize that they are in fact requiring masks, oftentimes they brought that up with a caveat, well, we're requiring it, but we're not providing any sanctions. So essentially, to answer your question, they would say we're requiring it, but if people don't do it, we're not doing anything about that. And so are you really requiring it then? Are you penalizing people? Are you withdrawing services? Those are all things that they simply were not willing to do. And so in effect, were they actually requiring it? And so rather than basically taking a stance that, of a position such as that, but the adverse side, recommending versus expectation, because you said it sounds a lot like recommending. Well, recommending sounds like we hope, or that we think you should, but that's up to you. Whereas expecting, it definitely has a little bit more of a tenor to it that says, we expect you to do it because it is the recommendation from the medical community, as opposed to trying to digress into constitutional conversations or the political situation of where it is. It kind of sidesteps that binary and instead pushes us into what our hope is really a focus on safety of students, safety of their families, and safety of the workers. And hence, the term expectation was chosen carefully for that purpose. So I hope that answers your question.
Kind of, sort of. So is there going to be some type of, you know how you have to sign 500 papers when school at the beginning of every school year? Will we be, as parents, required to sign some type of waiver for returning back to school, saying that we accept these risks that come with returning back for in-person instruction? And the reason why I'm asking, because I think it's kind of hard to ask somebody to sign a waiver for something if there's only an expectation to wear masks. So is there's an expectation to follow CDC guidelines, but it sounds like not a firm requirement.
Yeah, the term expectation is chosen very specifically, obviously in light of the current context of you know, this is, again, not something that we're just debating. This is something that's happening all across the country. Even in our communities, we're seeing the various municipalities grappling with this very issue. So I would say that I appreciate what you're saying. You know, the recommendation today is to utilize the term expected and just what is being proposed here, not necessarily signing waivers or anything along those lines. That's not a part of this recommendation today. Just to strengthen the language from recommendation to expected.
Do you have any additional questions?
Well, I just don't feel like the question was answered about the waiver part, because if you're not going to require it, then I just like to know, and this is purely, of course, from a parent standpoint, if I'm going to send my children back for in-person instruction, will I be required to sign a waiver? My son runs cross country, and they have to do waivers for sports. So I was just curious if a waiver would be required for, you know, regular school.
At this point, I
did try to address that. No. At this point, we're not putting a waiver. That was not part of this recommendation, so I thought I did answer that, but my apologies, Joel, if that was not clear.
Thank you.
Thank you.
Okay, our next speaker is Brenda Clark.
Hi, I guess I'm a little confused just because I thought I was on the health committee, subcommittee, and this wasn't even brought up. It was just kind of the decision was made without input from any parents or anybody else that I know of. I understand the language. However, I myself have been harassed or attacked for not wearing a mask, and what's going to happen at school when the kids are mask shamed for not wearing a mask by teachers or other students or other staff because they're jeopardizing the public, because this is what is being put forth in the media. So, I mean, there's a whole lot of issues with this. So if it's a recommendation and kids, you know, have medical disabilities, obviously it's a recommendation, but are they discriminated against? Then they're forced to homeschool so that they don't get shamed. I mean, there's a whole bunch of issues surrounding this. So I guess I'd like to know how you're going to deal with the safety of our children for, I guess, choosing not to wear a mask.
I think, number one, that's a good question to ask. And certainly we're seeing, you know, I appreciate what you're saying. The last thing we want to do is subject children to harassment based on, you know, belief systems kind of reinforced by the family that's obviously playing out in a larger political environment. That said, you know, our top priority really is going to be the safety of students, their families, and our workforce. That has to be our paramount consideration, and that's why this is being applied in the transportation setting, where we cannot engage in the type of distancing, you know, that would allow us to forego that type of recommendation. To be consistent with what is being recommended medically, the advantage with busing is that, you know, in terms of just applying the standard across the entire school context, is that the transportation is not something that families have to do, but there are many families who simply have no other means to get their children to and from school, and they really rely upon this. And so imposing a health standard to them that would jeopardize them to choose between a standard that they simply can't participate in education because they have no other means, those things are heavy consideration. So I can't possibly, you know, Brenda, I really appreciate what you said, and I can't possibly tell you that I'm going to have an answer that everyone's going to be satisfied with, and people have to vote accordingly. That's why it's being brought as a recommendation to this group, specifically in the transportation context. I understand Dr. Spiro did bring up the large group gathering pieces as well, but I'm speaking specifically the transportation context. That's why this recommendation is coming forward. But I understand the opposite part of it, and also that we'll do everything in our power to try to make sure that there's clear procedures and protocols around how students who choose not to wear masks, or families who vehemently oppose mask wearing, that whatever we can do to try to ensure folks are protected and not harassed will certainly be something that we take great care in as well. So I hope, I may not answer it fully, but that's to the best that I can in this piece.
I guess the second part of that question is, I've done tons of research, and there's a study that was put out by the YMCA where there was over 40,000 children and over 1,000 staff that were watched, and not one developed any case of COVID. So where is the documentation that we're working off of that kids are spreaders? Because everything I have seen, all the models that I've seen that are from overseas where kids are returning back to school, there is no instances where kids are transmitting this virus. And so I'm wondering, where is the documentation that we're basing this decision, which is affecting 1% of our population in the county, and we're changing the lives of 96,000 kids? So I'd like to know, you can't say CDC, because CDC says it's good one day and it's not good the other day. I understand it's a changing, evolving environment, but where's the documentation on how this affects our children transmitting it to the staff?
Well, I'm not a medical expert by any stretch of imagination. That's for sure. And so I'll certainly let anyone who would like to answer the medical side of it. But I can say, that just from what we have been able to review is just that, simply put, that there's a lot of unknowns about this virus and how it is transmitted completely, and that has evolved. I mean, just in the months since we have, in the United States, since we've done our shutdown since March, just how the recommendations have changed, the risk, all the different mitigation strategies. There's so much that fluctuates. And so just from a policymaker and practitioner standpoint that we're charged with, operating at a scale, a significant magnitude, nearly 100,000 students, we have to err on the side of being extremely cautious and really relying upon guidance that is relayed to us, via all the different sources we have, whether that is the CDC, which just provides simply recommendations, the Department of Health, our local providers, American Association of Pediatrics, everyone that puts forward anything from a reputable source. We take all those things and really then allow our medical professionals to give us the best guidance they know, which I think most of them will be the first to tell you that they continue to evolve their position based on the best information they can share, the best recommendations they have to try to keep us safe. And that really is the way we tend to approach this. That said, I would certainly allow someone else on our team who would actually care to speak to it if they choose to try to address more of what you said there, specifically on what you have researched and the 1% impacted and so forth.
Hi, it's Dr. Saunders. I'm happy to speak to that. But we do know, as with many other respiratory viral illnesses, that children can be a source of spread of those viruses, not only to other children, but as well as to adults. And part of the problem comes because children can't always follow the same instructions that adults do, covering a cough or a sneeze, washing their hands afterwards. And even in our community, we have seen the spread of the virus among other children, as well as to the adult family members. So if you take the lessons that we've learned from many other viruses, influenza, as we go through flu season, and apply those to COVID, and as well as the studies that will come out with COVID and how it can be spread by children, among adults, those lessons are learned that we can apply as we go forward in this situation. So where you have mitigation with source control, and source control would be the use of spreading into the air, containing any droplets that happen when coughing or sneezing occur, those are always the best first mitigations that you can use. But, you know, there are times when those are not going to be able to be.
Dr. Saunders, we've lost you.
Frequent hand washing. So there is ample literature that does demonstrate that these viruses can be spread among children to adults as well as vice versa.
Thank you, Dr. Saunders. We lost you for a couple of seconds there. I believe that we got the most pertinent pieces of information you had to share there. Thank you so much for your addition there. Ms. Clark, do you have any additional questions?
Yes, I do. The issue of eyes has not been addressed at all. Everybody talks about mask. Well, as Dr. Saunders says, these droplets that spray across the room and they are going to land on the mask. Well, what about the eyes? So there's, you know, we're pretending this is going to work, but we have no research to back it up. And I'll leave it at that. That's just an open-ended question. So what is the end date of this? Is this like we're going to allow this to happen or recommend this for a certain period of time and reevaluate the risk? Or is this going to continue all year? Or what's the end plan for this?
At this point, we are basing these types of decisions on input from health professionals. So we are in practically, well, actually daily contact and sometimes multiple times a day contact with our Department of Health. We also are in regular contact with our local healthcare providers, including Lee Health. So if they came to us and said, you know, we're seeing a decrease and we believe that these precautions are no longer needed, then certainly we would say, okay, let's go back and look at that. But until we see a decrease in need, I don't believe, and if I'm wrong, someone I'm sure will correct me, but at this point, I don't believe there is a set time certain that we would go back and make that review.
Okay, and my last question is, who's liable if something happens to one of these children from wearing a mask?
I'm not hearing anyone jump in there. So I believe
it's a liability question, I think, is what the question was, who's liable?
Yes.
I think probably the only person who should respond if it's from a district standpoint would be someone with a legal basis to evaluate liability on that standpoint. So it would not be me.
Yeah, I was just going to say, I'm not an attorney, so I wouldn't be able to answer the liability question, but certainly we could get an opinion of one and provide it to the group. I think in terms of a long-term evaluation of this plan, as Cindy said, you're looking at a number of factors. We are in contact with our Department of Health on a regular basis. Lee Health is also a major healthcare provider in our community that we are in contact with, and we also gives us an opportunity to really evaluate, the impact of the spread of this on our community in terms of, what is the impact on Lee Health in terms of its availability of beds, its capacity as a hospital system, and so forth. And then the last piece is, of course, our state officials, Department of Education, and then the governor's plan as well, because you're talking about right now we're in a phase 2 portion. There is a different portion there, which is a phase 3, and there's a different set of guidelines when it comes to the phase 3. So all of those things we are in the process of weighing as we move forward, because this, as I started this conversation, this is a fluid situation that is ever changing. And I think we have to, one of the things, whether you read the recommendations from the American Pediatrics Association or some of the other plans that are out there, agility and the ability to adapt to a changing situation is something that has to be a part of any plan.
And Dr. Atkins, I'm here, and I apologize, I'm a little under the weather, but again, with respect to liability, I think one of the reasons that I think has been articulated over and over again is that we are following the recommendations of the Department of Health as well as CDC guidelines. I think with respect to wearing a mask, which has been suggested by, multiple agencies as well as multiple medical officials. I think everything that we're doing is to limit exposure. This is a very novel concept. I think to say that there's a case right now on wearing liability associated with wearing a mask as it relates to COVID-19, I don't believe there's a lawsuit on that yet. So I think that, again, adhering to those guidelines and following recommended practices is the safest way to reduce exposure, and is consistent with what most, if not all, districts are doing across the state.
Thank you, Mr. Williams. Thank you. Our next speaker is Kevin Daly.
Hey there. So I guess I'm going to ask for a point of clarification, then I'm going to ask some other questions. So it's my understanding, and again, I'm not an attorney, but I was an ASE teacher. And so it's my understanding that transportation, unless implicitly implied in the related services portion of an IEP, is not mandated. And so, as Dr. Savage has said, certainly the choice exists if a parent, whomever they are, decides not to follow the expectation, that they certainly, they don't necessarily need to ride the bus. And, so that's the first thing. And maybe somebody can affirm my belief or set me straight. Kind of the second point is there are two municipalities, Sanibel and Fort Myers Beach, that have mandated masks currently, and the city of Cape Coral is struggling with that now. So I guess for the beach school out of Fort Myers Beach and for the Sanibel school, are their expectations or are their requirements different because their local municipalities have passed mask rules, and if the county passes one overall, does that cover everybody? And lastly, what do you think, well, not lastly, but second to lastly, and ultimately, what do we think the criteria are to move that kind of expectation to the classroom, if we're not able to achieve the appropriate social distancing? And I'm also with Ms. Clark about this idea of, with everything, when and how do we decide to take our foot off the brake and move it on the accelerator, or take it off the accelerator and move it on the brake? Because, I think things are changing with this every day. I think we're getting better at treating it. I think the idea of a vaccine out there is real and will probably happen. And January could look incredibly different than now. I'm hopeful for that, but hope is not a strategy. So just those are kind of my concerns around this as well.
Thank you, Mr. Daly. And as Dr. Atkins mentioned, we are following to the best extent possible the governor's recommendations and looking at those different phases. And, if we move into a phase where the masks would not be a recommendation, then obviously we would be looking at that locally as well. Thank you. Our next speaker is Mrs. Vaughn.
Okay, I'm going to take a really hard line on this because I am an adamant believer in wearing a mask. Editorializing briefly, we wouldn't be in the situation that we're in right now in Florida, and this is according to multiple health experts, if more people would social distance and wear a mask. As a matter of fact, I'm debating whether I'm going to say yes to this recommendation, because I would like to see the language required. As Mr. Daly said, I don't believe in Florida that it's mandated that a school district has to give bus transportation, is it? Can Dr. Savage answer that one? I don't believe it's mandated.
My understanding is that except for certain vulnerable populations or identified, I didn't mean to say vulnerable populations, identified populations that are expected to, that are required to provide those services. These would include students who, from an IEP standpoint, were mandated to do it, or potentially homeless students that were federally bound to provide transportation for. It is considered something that is not a requirement. That said, though, if families have an inability to access education, especially in areas such as like ours, where there's a great documented level of need and transportation is relied upon heavily to to access a school, a physical school, then, that's a little bit more of a gray area. So I wouldn't take a hard line that, just we can just take transportation off the table for all families. I think that's, I want to make sure people understand that when we arrive at these recommendations, we're doing so after
That's not what I'm
evaluation of a lot of
saying,
cases.
Dr. Savage, not what I'm saying.
Okay.
I'm just saying, first of all, we don't have to offer it. And secondly, to go with what you just said, everybody's going to have access because they'll have the Chromebooks and they can go Florida Virtual or they can go the Lee Home Connect. So that's a moot point. In the classrooms, walking around in the schools, there's the possibility of some social distancing, at least 3 feet. In the bus, probably not going to happen. I was just watching a report last night about, and this is just something that the scientists have been studying, about the difference between the droplets and I forget what they call it, like an aerosol, like the microscopic particles, which can hang in the air after a cough or a sneeze for hours and hours. There's a big difference between the two. And my idea for a recommendation would be to use the word required and give the parents who have children who are, let's say they have asthma or some other physical respiratory distress that could be verified by a doctor, that those children could get waivers and still ride the bus. And perhaps there'd be a certain section of the bus where we'd be able to do a little bit of social distancing. I heard a couple people say, well, if the children choose to not wear a mask, I'm sorry, as a teacher for 38 years, the children don't choose. The school district makes rules and the parents choose, not the kids unless they're emancipated minors. Finally, Dr. Savage, with all due respect, I surely wouldn't advertise the fact that we're going to use that stronger language, which is expected, but we're not going to do anything about it if they don't. I mean, really, we need to be able to provide disposable masks, and certainly children who don't have a physical disability with a doctor's note can wear a mask for 30 to 45 minutes or whatever. Hopefully they don't have bus routes that are much more than that, at least on the bus, because I feel like once they get into the building, there are more opportunities to spread out, but not on the bus. So actually, I'm not going to support this unless it says required. Those are my comments on that.
So, Mrs. Vaughn, are you making a motion to change the language of the recommendation?
I'm just saying I'm going to bet that most people are going to support it, but I just wanted to clarify ahead of time why I'm not going to support it, although initially I made the motion and I thought, yeah. And then as the discussion evolved, what are we here for? We are here for the safety of our children. We're not here politicizing. It's become a political issue, and that is shameful that it's become that way. And I very, very strongly feel that we in Florida, and we're right at the top of the heap along with Texas and Carolinas and a few other states, we're in bad shape. And Lee County is not one of those counties that might have 5 infections. Unless it flattens, I just don't see how we can protect our children on the bus. And even though I made that comment about the buses, I think it is something that children should have access to get to their schools. But certainly to require just for the bus ride to protect the other children, to protect the bus driver as well, surely that is not too much to ask. And I won't change the motion, we'll keep it, but I'm not going to support my own motion.
Okay, thank you. Thank you for the clarification. Our next speaker, excuse me, a couple people waiting to be admitted, I just saw, so let me admit those very quickly. Thank you. And our next speaker, see, Mr. Daly, no, I'm looking at it wrong. Mr. Campachuro.
Thanks, Cindy. If we keep the language of expectation with the masks, is there going to be an expectation of teachers to remind students daily of the expectation to wear a mask in school for large, gatherings, or transitioning to the cafeteria or to a gymnasium? The only reason why I bring this up, I'm thinking more primary grades, that first, I'll give you a scenario. A parent doesn't want their child wearing a mask in school, right? And then the teacher says to their kids as they're getting ready to leave their classroom to go to the cafeteria for lunch, okay, don't forget to put on your masks. The student goes, a little kindergartner, first grader, I don't have one. Teacher gives that student a mask. Kid goes home and says, well, my teacher gave me a mask to wear today. It's just going to put the teachers in a precarious situation. So is it going to be just something unspoken that the parents discuss with their children, or teachers going to have to be reminding children daily if they have a mask to put one on? So those are just some concerns.
Excuse me, aren't we talking just about buses?
Thank you. And yeah, I was just about to clarify that the discussion right now, and that probably came from my discussion earlier, my statement earlier, that we would extend that. But this particular motion was around transportation.
Right. It's just on buses.
Yes, but we will talk about the other one in our next.
Right.
Okay, sorry.
That's
Jumped
okay.
the gun.
Thank you. Our next speaker is Crystal Vervat.
Hi. So I think some of my questions were already asked, but my concern with some of the other comments that came up, and I might be kind of going a little bit off topic straight from the buses, but at what point, because I send my kids to school to get an education. I don't expect the school to monitor their healthcare decisions. Yes, I do expect some, obviously, safety protocols, which I think is normal, but at what point is the line overdrawn? And, some people are saying masks should be required. I know I have a lot of people that are watching this live right now, and just with the comment of with the stronger language of requested or required or not being required, some people have already said if they're required, I'm taking my kids out of school. So I know this is not an easy topic. I know you guys are doing the best you can to keep the kids safe and try to not transmit things, but a lot of people are saying, I want my kids to get an education, and it almost seems like some of these things the line is being overdrawn. So, keeping it optional is, what I would go for, and I would vote yes for. Required, I think there would be a lot of issues. So, and I know it's not just with us, it would go into the classrooms and all the other settings as well, but there's just a lot of concerns around masks. And for the record, the kid choral vote got shot down yesterday because there was a lot of speakers in opposition, and a lot of the council members actually changed their vote based on some of the constituents' speeches. So I know it's not an easy topic, but that's just what I wanted to throw out there.
Okay, thank you. Appreciate your comments. Mr. Daly, since you've had a turn to speak on this one, I will come back to you after we've had everyone have their first chance, since we are very tight on time right now. Jamie, I don't believe you have spoken yet on this. Jamie Michael?
As I represent the bus drivers, they would really like it to be required. However, kids do things all the time they shouldn't do on the buses, which sometimes puts them in jeopardy. There will be seating charts, and so if their parents choose to not wear masks, then there will be a seating chart, and kids that wear masks will probably be one place and kids that don't will be another. We need to remember that we need bus drivers. If the bus drivers get sick, who's going to drive the bus? There's only so many substitutes in order to drive the bus. They will be delivering to schools daily, which is a different group of children. And if one of those children infects a driver, you're not going to have a driver for a little bit. Then you're going to have to deal with a sub, and they tend to run later because they don't know the routes. When you have a regular driver that knows the routes, it's not just, it's the safety of the other students. It's the care and compassion for other students. It's the care and compassion for the bus drivers. I don't know what else to say. I wear a mask when I go out for everybody else, but because of the politicized thing of masks, I'm not going anywhere. Restaurants are not getting my money. Home Depot's not getting my money. I have written the county commissioners, but you will not catch me showing up to any county commission meeting to stand up for masks. The economy will suffer because it will not have my money, and I know I'm not the only one. We already have drivers who have been in the hospital with COVID. Can our hospitals continue to take this? If a child gets COVID, are they staying in Lee County, or are they taking them to St. Pete or Miami, which is another hardship on the parents, especially if there's more than one child? You need to think of the whole family. And, you know, you're saying 1%, but when you know someone that has lost 2 family members to this, it is more than 1% when it is your family. It is heartbreaking.
Thank you, Jamie. Next speaker is Jewel.
I don't want to get into like a political debate about the mask, but at the end of the day, we're all subject to rules and regulations, and some things you just don't get a choice in when it comes to rules and regulation. Do we scream and yell about the speed limit signs, or just regular rules of society, of civilization? You know, some things you don't get a choice in. And, you know, just like if I went to Publix and they said I needed to wear a mask and I didn't want to wear one, well, guess what? I don't have to patronize that business. And I feel like options have been presented for those who anti-mask or whatever it may be. There are options for you. You know, like I'm saying, just some things I agree with Ms. Vaughn. I think it should be required. And this is the whole problem just nationwide, where everybody's on the fence about everything because nobody wants to offend anybody or anything like that. It's just some things you don't get a choice in. And I feel like this is for the public interest. It's not your personal thing because you don't want to wear a mask. What about my rights of my health and, you know, for my family? You know, so the argument goes both ways. And I feel like this should be something that you need to be firm on. Either you're going to do it or you're not going to do it. Because, again, some things you don't have a choice in.
Thank you for your comments. Amy Jane McWilliam.
I also agree with Ms. Vaughn about requiring masks on the buses, especially since we're not taking temperature checks at the buses and we are accepting all students for their safety onto the bus and bringing them to school. I think it's a reasonable request to say that we require masks, especially if we're supplying those masks to the children. And then once they get to school, that's a different situation. But I think I would like to propose, and I don't know if I can, but can I propose that we change the wording to requirements on the bus for the mask?
Yes, you can make that motion. And I will say up front, I am not a parliamentarian.
Okay.
And so if Mr. Williams or Ms. Vaughn, if I do this incorrectly, please feel free to correct me. But I believe that you can make a motion to change the wording. We would have a quick discussion around that and then take a vote on changing the wording of the current motion.
I second.
Thank you.
That's correct. You have to vote on the amendment, and then once you approve the amendment, then you would vote on the new, what's been now amended. So, yeah, there's 2 votes.
Or can I, since it was my motion, I can do it without that extra step? Mr. Williams?
That's correct.
Oh, I could do it?
Wait. So restate what you said. I apologize.
I was the one that made the original motion. And what I'm wondering is if we could eliminate one step by having me amend my own motion.
Technically, Robert's rules, you would need to vote on the amendment, or you could just vote down. You could vote down your motion and then do a motion with the language that you want in there. So two ways, you can do it. You can vote to amend it, which would require a vote on the amendment, and then you vote in favor of the amended request, or you could vote down the motion and then do a motion with the same exact thing, putting in the required in lieu of the expected.
Thank you, Mr. Williams. So I have a motion and a second to amend the current motion to say, rather than masks are expected to be worn in consistency with medical advisement, to say masks are required to be worn in consistency with medical advisement on buses. Okay, is there any further discussion around the amendment? Mr. Daly.
Thanks. So I'm trying to stay away from the fact that masks have become politicized, and I'm trying to be sensitive to people and their individual liberty and free speech and things like that. And really a discussion we haven't had yet, which I had this morning with several people, is the idea of First Amendment rights related to students possibly putting things on their masks. And how they're covered and what the rules are there. But the more I've been thinking about this, the more I've been thinking that, perhaps this is our World War II moment. As we look back at World War II, a lot of people were required to sacrifice a whole heck of a lot. And I don't know, I wasn't there. And of course, history is always kind of glamorized and like that. And so I don't know if there was mass protest against, the idea of rationing or the idea of any of these things, or the victory gardens or anything like that. But this is our opportunity to perhaps take a small step for a short period of time to ensure that things, don't necessarily get to somewhere where we don't want them to be. Because, like Jamie said, it's, it may be a small portion of the population that are testing positive, but, when it knocks on your door and it doesn't care which political party you belong to, it doesn't care what your race is, what your socioeconomic status is. When it comes knocking on your door, it's a pretty serious thing. And, I heard somebody this morning say, I'm not going to debate whether or not it's 8 people dying or 25 people dying. I'm just going to say people are dying. And again, this idea that students are enabled or are owed an education, that's fine. But again, at what expense? Is it appropriate to say, I want to possibly expose a bus driver to COVID-19 who has a secondary health condition and may possibly die, because again, not being an alarmist, that's an outcome. So is it worthwhile or appropriate to ask that the staff of the school district lay down their lives to allow people not to wear masks or to put themselves in unsafe situations? Again, I know doctors who wear masks for 12 hours a day and have forever. And they're asking on the bus for an hour a day, tops, one way maybe. So, I would be supportive of required. I just know, taking the lay of the land, it's going to be an unpopular recommendation. I can just say that right now, but, and again, nobody really answered my question, and this is for the main motion, about whether local municipalities or a countywide ordinance, would essentially solve the problem for us. So do the kids that ride the beach bus or the Sanibel bus, are they required to wear masks? Because there are things there, but anyway, that's kind of my commentary on the amendment, at least, and so I'll leave it there.
Thank you. And I will defer to Mr. Williams, but my understanding from just articles I've read is that those municipality rules do not apply to the schools within those municipalities. Mr. Williams, do you know if that is correct?
That's correct.
Thank you. Okay, seeing no additional hands, I will call the vote and remind you that this vote is on changing the motion, amending the motion to say masks are expected to be worn in consistency with medical advisement on buses. And again, we will do a voice vote. And
Cindy?
yes,
The motion is required to be worn, not expected.
I'm
right?
sorry, I read it instead.
I know you did it, but I just wanted to like really catch you before we started calling the roll.
Thank you. Yes, masks are required to be worn. I should not be reading, I should be remembering, are required to be worn in consistency with medical advisement on buses. Thank you for that correction. Again, we will do a voice vote, and please answer verbally, as it's 2 screens worth of faces, so I cannot see your faces. Cannot see all of the faces anyway. Yamasil Bermudez.
Yes.
Thank you. Marshall Bauer.
Yes.
Yes, I can't hear him. Okay. Carl Burnside. Carl Burnside here. Okay, I'm not hearing anything there. Joseph Campatero.
Yes.
Yeah. Brenda Clark.
So this is on the required, not, or the recommended, not required.
This would change the amendment to read, would change the motion to read that it would say masks are required to be worn in consistency with medical advisement.
Okay, I thought he just corrected it and said that this was not on the change. Can I get some clarification on that?
I had originally read it wrong. I had said masks are expected, and what I should have said is masks are required. We are not voting on accepting that they are required. We are voting on changing the motion to say that, and then we'll have to go back and vote on the motion.
You're voting on the motion to change the wording?
Yes.
Okay, then I decline. No.
Okay, thank you. Kevin Daly.
Yes.
Thank you. Isaac Dozier.
Yes.
Thank you. Captain Fields.
Yes.
Thank you. Marcus Goodson.
Yes, I support it.
Thank you. Brooklyn Gossett.
Yes.
Thank you. Angela Haas.
Yes.
Thank you. Julian Harris.
Yes.
Thank you. Scott Hertz, I don't believe is on the call. Thank you. Samantha Howard.
Yes.
Thank you. Melissa Lehner.
Yes.
Thank you. Scott Lemaster.
Yes.
Jacqueline Lineberger.
Yes.
Amy Jane McWilliam.
Yes.
Thank you. Jamie Michael.
Yes.
Harlan Parrish.
Yes.
Lieutenant Cuepo is not on the call. Dr. Mary Beth Saunders.
Yes.
Thank you. Sharniqua Shea Smith.
Yes.
Thank you. Sedona Stewart.
Yes.
Thank you. Betsy Vaughn.
Yes.
Crystal Vervat.
No.
Thank you. And Heather Rodriguez Wibbles.
Yes.
Thank you. Okay, so let me get a quick count. Carl Burnside, did I miss you? You may have dropped off the call. Okay. We have 23 yeses, 1 no, and 3 who were absent for the thing. So for the roll call vote, so it passes. Thank you very much.
I think there were 2 no's.
Where to know?
Cindy, there were 2 no's.
2 no's. I have a no from Brenda Clark
and a no from Crystal.
Crystal Vervat. Oh, I'm sorry, I misunderstood that. I had that down as a yes. Thank you for clarifying that. Okay, so we have 2 no's. (22-2). Thank you. So now we go back and vote on the motion itself. We have now changed the language of that motion, and the motion is now that masks are required to be worn in consistency with medical advisement on buses. So we will do another roll call vote, and this time you are voting to require masks on buses. Okay. Yamasil Bermudez.
Yes.
Marshall Ballard.
Yes.
Mr. Burnside? Must have dropped off. Okay. Joe Campaturo.
Yes.
Thank you. Brenda Clark. Ms. Clark, are you there?
No.
Thank you. Kevin Daly.
Yes.
Isaac Dozier. Mr. Dozier?
Okay, had a technical difficulty, yes.
That's okay, there we got you. Thank you, yes. Captain Fields?
Yes.
Thank you. Marcus Goodson?
Yes.
Brooklyn Gossett?
Yes.
Angela Haas?
Yes.
Julian Harris?
Yes.
Mr. Hertz is absent. Samantha Howard?
Yes, sorry.
That's okay, thank you. Melissa Lehner?
Yes.
Scott Lee Master?
Yes.
Jacqueline Lineberger?
Yes.
Amy Jane McWilliam?
Yes.
Jamie Michael?
Yes.
Harlan Parrish?
Yes.
Dr. Saunders?
Yes.
Shay Smith?
Cindy, she gave a thumbs up.
You did, thank you. Sedona Stewart?
Yes.
Betsy Vaughn?
Yes.
Crystal Vervat?
No.
Was that a no?
Yeah, no. Negative.
Thank you. And Heather Rodriguez Wilbels?
Yes.
Thank you. So the vote again is 22-2. The motion carries to require masks on buses to be worn in consistency with medical advisement on buses. Thank you. So now we move on to the discussion around around masks in the schools. So right now, the recommendation is masks are expected during class transitions and in large spaces such as cafeterias and gymnasiums. Do I have a motion to accept? A motion to accept the recommendation to expect masks during class transition and in large areas such as cafeterias and gymnasiums.
I'll forward the motion. It's Amy Jane McWilliam.
Thank you. Do we have a second?
Hi, this is Isaac. Before we move forward, I do have a point of clarification. In the earlier session, we discussed the students will be eating lunch in the classrooms. Will that change?
I believe that students will be eating breakfast in the classrooms, but they will not be eating lunch in the classrooms. They would be eating lunch in the cafeteria and, when available, outside spaces.
And it might also, Cindy, just clarify for breakfast, there might be larger areas where students could social distance in the morning in the cafeteria or outdoor areas if schools were able to orchestrate that. That might be a possibility as well. And lunch would not be in the classrooms. Those would be in larger areas where the students could social distance.
Thank you, Dr. Spiro. Does that answer your question, Mr. Dozier?
It does, and that's why the vote, I think, is going to be difficult because it's just all-encompassing of all spaces. And if they're going to eat lunch, how are they going to wear masks? I'm just from a practical perspective. So are we talking about lunch, during lunch, or are we talking about in general? Those are different.
If we can go ahead and get a second, then we'll move into discussion where we will discuss those details.
I second.
Thank you, Brooklyn. So we now will open that up for discussion. And Mr. Dozier, since you were already asking those questions, if you will go ahead and talk a little bit more about your questions related to the masks in other areas.
Yeah, I just would like to formally make a recommendation that we amend the language to specifically vote on common areas other than during lunchtime. Because I think the lunch period and how you social distance should be managed differently.
Okay, so we
you can't wear a mask and eat at the same time, basically.
Yes. Dr. Spiro, did you want to speak to that?
Oh, yeah, just like people when they go out to eat now as well, masks would be off while they're eating their food. And there'll be social distancing as well. It's really to travel to breakfast to lunch, if you're traveling back in those large areas where students may intersect. Because remember, we're going to try our best to keep students socially distanced using a lot of different areas while they're at lunch as well.
Thank you. And I believe that cafeterias might be used for other activities if a large area were needed for some other activity during a dismissal process, for example. So when cafeterias are mentioned, I don't believe they were specific to just lunchtime. Mr.
Cindy, this is...
Yes.
Cindy, this is Marcus Goodson. I've got a question I'd like to jump in. I'm struggling. I'm driving, and I'm being muted and unmuted, so I just want to jump in real quick. Just so you know, I support wearing a mask at all times, period. I think the comments from one of the speakers a few minutes ago was point on. But having said that, I know it's a personal decision that does affect other people. And the question I have is there's some families that have kids in the district that obviously may not have the means to purchase masks on a regular basis because you're not going to wear the same mask every day for 2 or 3 or 4 weeks. And you may have covered this, I may have missed it, but are there any plans by the district to provide masks for those kids whose families do not have the means to purchase masks? Because yes. I think they should be wearing masks as often as possible. And the answer to that question is yes?
Yes.
Okay, thank you.
You're welcome. Thank you. So, Mr. Dozier, I'm going to come back to you for a moment. Do you still want to amend the motion?
I just don't think it's clear. I don't know enough about how the social distance is going to be managed during mealtime, breakfast or lunch. But where I heard the motion, it was all encompassing for the transition as well as when they reach the destination, which would be the large area. And so I was thinking particularly of how there's not enough specificity around how the mealtime is going to be managed. I understand what's been done at restaurants, but I also have eyes, and I know that people aren't following those social distancing protocols at a restaurant. So, I heard someone say earlier that, kids follow rules, parents help to set the rules. And so these are children, some of the most vulnerable folks that we're working with, some of the most vulnerable people in our society. And I just think that we should take our time and be clear about what's going to happen while they're eating, not just transitioning.
Do you have recommended language to amend this motion?
Yeah, my recommendation would be to just include just the transition, the language that speaks to transitioning. I think we should just vote on that alone and then vote on mealtime separately.
So with the transition, it also refers
if I could clarify, it is, as I said earlier, it is the transition to and from the cafeteria. Students are not expected to eat with their masks on. That was not the point of this recommendation. This was try to support with Dr. Savage, what he was talking about as far as trying to keep students safe during those times when there could be possibilities of closer interactions with other students. So that's the purpose of it. So, Mr. Dozier, they're not expected to eat with their masks on. This is during the transition times, as you were referring to.
I believe his confusion comes with the additional language of and in large spaces like cafeterias and gymnasiums.
Right.
So perhaps if we were to add with accommodations for meal times, would that clarify it for you?
I think it clarifies that point, but it's the same thing as the bus transition. The whole purpose of this is to have clarity, and so we're all on the same page. So to leave it vague, and everywhere else we're trying to be specific, now we're going to say transitioning, and then when they're in large spaces, we're going to accommodate as needed. But what does as needed mean? So that's just that was the reason I was saying I think we should separate the two.
Do we have a second to separate the two items?
I'll second.
Sorry, I didn't see.
Kevin Daly, sorry, I'll second. Again, you're next to me on the screen, so I think you can see me, but I know you can't.
That's okay, thank you. So we have a motion to separate transitions. Mr. Dozier, please correct me if I have this wrong. We have a motion to separate the masks are expected during class transitions as one motion, and then masks are expected in large spaces. Okay, I'm really going to need you to clarify for me.
You got it in a nutshell. You got it. We'll vote on the transition spaces, but I think we should also vote on the large spaces, what's going to happen.
Okay. So we are now going to have discussion around the motion to separate transitions from the large space requirement. And I know we have some hands up already. So if you do not want to address that, just say pass and we will come back to you. Samantha Hauer.
I've got an overall question, so you can come back to me if you need to.
Thank you. And before I do move forward, I just looked at the time. We are 2 minutes, 6 p.m. So I would ask for agreement to extend this meeting to continue discussion around the options that have been discussed. Do I have agreement to extend the meeting? Okay, I'm seeing lots of thumbs up.
Yes.
Okay, thank you. Okay, so we will go ahead and extend. Okay, our next person with a hand up is Mr. Daly. Do you have a comment about the separation of the two items?
No, ma'am, not about separation. My comments and questions are more global in scope.
Okay, thank you. Mr. Campitura.
You could pass for now.
Thank you. All right, so it looks like we have no discussion around that. We'll go ahead and call for the vote on separating the two items, the transitions from the large spaces, cafeterias, and gymnasiums. Yamasil Bermudez.
No.
Marsha Bauer.
Yes.
Carl Burnside. Oh, he dropped off. Joe Campitura.
Yes.
Thank you. Brenda Clark.
This is voting on separating the two spaces?
Yes, ma'am.
I vote yes.
Thank you. Mr. Daly.
Yes.
Thank you. Mr. Dozier.
Yes.
Thank you. Captain Fields.
Yes.
Thank you. Marcus Goodson.
Yes.
Brooklyn Gossett.
Yes.
Angela Haas.
Yes.
Jolene Harris.
Yes.
Thank you. Samantha Hauer.
Yes.
Thank you. Melissa Lehner.
Yes.
Scott Lee Master.
Yes.
Jacqueline Lineberger.
Yes.
Amy Jane McWilliam.
Yes.
Jamie Michael.
Yes.
Harlan Parrish.
Yes.
Mary Beth Saunders.
No.
Shaniqua Smith. I can't see Shay, so if someone does see.
She gives a thumbs up.
Thank you. Sedona Stewart.
Yes.
Thank you. Mrs. Bond.
Yes.
Christopher Vatt.
Yes.
Thank you. And Heather Rodriguez Wibbles. Ms. Rodriguez Wibbles, are you there?
I'm not seeing her name anymore, Cindy, but she may be on the phone. I can't tell who's on the phone.
Thank you. Okay, we have 21 yes and 2 no's. So the motion to split the recommendation passes. So we will now discuss the first part of that recommendation, which would be masks are expected during class transitions. So I'll open that for discussion. And the first hand I see is Samantha Howard.
So I've kind of got 2 questions. One, I probably should have asked when we were discussing masks in general, but I missed my chance. If a student would prefer like those full face shields, would that fall under the umbrella of what we're calling a mask? Is my first question. And then
yes.
Okay. And then my question to the motion in general is, so I'm a high school teacher and my classrooms are easily 32. And if everybody chooses to come back, I'm not going to be able to separate them, especially being in a computer lab. So would it not also be important to discuss extending that recommendation to classrooms like mine where they would be on top of each other to also recommend wearing those masks as well?
At this point, that would be a new motion. Okay, so once we get through this, if you would like to introduce a new motion, you're welcome to do that. Thank you. Okay, the next one is Kevin Daly.
Hey, thanks. So I guess I'm struggling with manageability. I mean, I think as well, especially, and this may be geared towards the second half of this, we just separated. But, you know, I know in schools, and maybe the other principals can chime in here and the teachers, that, you know, they do everything they can to have as many lunch shifts as they can. And if we follow the CDC guidelines for restaurants at 50%, so instead of having like 4 shifts at South, you're going to have 8. And, because, you know, not everywhere has everything, but I'm struggling with manageability at the school level. And also, you know, along the lines of what Sam said, you know, I think we should have some idea because we still haven't seen what a classroom looks like with social distancing, because, you know, we don't really know how many kids are going to come back. So Sam may have the same number of kids, or she may have fewer. And so, you know, the idea is to spread them out as far as possible. But again, there's not a lot of extra furniture in these rooms. And so, you know, I may not necessarily be in support of mandatory masks in the classroom at this point, but you know, I think we need to think about the same kind of rules, like what if we can't socially distance, and what would be the minimum acceptable distance, and, you know, can we meet that, can we not meet that? You know, that's kind of where I'm at-ish. I know Sam, for me anyway, Sam had her hand up, I think, to respond, so I don't know, Cindy, if you can see her.
I actually have kind of a, Heather Wibbles is waiting in the waiting room.
Oh, thank you. Thank you very much. Okay, Mr. Daly, are you finished with your comments?
Yes, ma'am. Thank you.
Thank you. Okay, the next speaker is Joe Campachuro.
I just wanted to circle back to my question when we were talking about wearing a mask on a bus. And that was basically, is there going to be an expectation of teachers to remind students of the expectation to put on their masks if we're traveling, or is this something that is just going to be unspoken and the parents speak to their child about their preference of what they want their child to do, just so that teachers aren't put in any sort of situation that could be problematic?
So I'll answer that, Cindy, for a little bit. The principals are going to be giving them constant reminders about hand washing, hand sanitizers, using masks, whatever we agreed to, say which just expected or strongly recommended. They'll be giving reminders all day long to students. If I was a classroom teacher and there was an expectation of a certain procedure in place, yes, I would probably remind my students for them to get used to what that process looks like until it becomes part of their normal routine, because this will be new for everybody.
Thank you, Dr. Spiro. Any additional questions, Jeff? Thank you. Okay, our next speaker is Jewel.
So piggybacking on our discussion about the buses versus expected and required, I like to add to the motion that it be required to, because you're in the class in close proximity, and to kind of piggyback on what Miss Samantha said, you could have 30 kids in a small class, you know. And another thing, has there been any consideration, I keep hearing about hand sanitizing stations for portable hand washing stations. Hand hygiene is extremely important in helping to control not just COVID, any sickness at all, or even toilet lids, you know, to prevent aerosols from flushing the toilet to, you know, get in the air. Just in addition, I know we keep talking about the mask, but there's other things too that can be implemented possibly to help with that. But I know I'm getting a little bit off on a tangent, but I would like the same recommendation for the buses to be required, not just an expectation.
Okay, so I'm hearing a motion to amend this language to say that masks are required during class transitions. Do I have
yes, in the class, yes.
During transitions. We haven't talked about in the class, but we're talking about transitions right now. Okay, do I have a second?
I second.
Thank you. Any discussion around the changing of the language to required during masks required during transitions? And I see Jamie's hand. Ms. Michael, do you want to discuss that, or was it for something else?
It is a really good idea, because not only transitioning, they're going into the cafeteria to pick up the food, and if a child sneezes, it is going to back up everybody behind them, because they're going to have to sanitize everything that student touched. I know my son worked in a restaurant. If somebody put their fingers in to get a lemon, the whole bowl had to be thrown out because of health department requirements. So I support it.
Okay, thank you. Brenda Clark.
Can you hear me?
Now I can hear you. Yes, thank you.
Okay. I'm beginning to think you guys have all lost your minds. I really am. I can't believe that you're actually thinking that our kids are supposed to be masked up in school. You didn't consult any of the health subcommittee. You're making these decisions all on your own. And honestly, you guys have already made your decisions. It doesn't even pay for us to vote. I'm absolutely disgusted. Thank you. I'm removing myself from the call.
Thank you, Ms. Clark. Dr. Saunders. Oops, I'm sorry, I'm looking at that wrong. It's not Dr. Saunders. It is Amy Jane McWilliam.
Hi, sorry, my dogs were barking. I think it's going to be a harder ask when we say we're requiring kids to wear the mask during transition time. On the bus, I think it's easily justifiable. If somebody doesn't want to put their child on the bus with a mask, they can look for alternate transportation. We don't do temperature checks for the bus, so that makes a lot more sense. I think we're going to have some issues with requiring the masks. I think you're going to find a lot of parents will go by the CDC recommendations. I already have masks for my child, but I think that's where you're going to come up against the wall with other parents. You're going to find kids with health issues, expecting teachers to have to help children with their masks, especially the younger children. I think it's going to be an issue. So there are concerns, and I'm a proponent of mask wearing. I don't leave the house without my mask. I think this one's going to be difficult for everyone.
Thank you for your comments. Mrs. Vaughn.
Yeah, I agree with what Ms. McWilliams just said, and going back to what Joe said earlier, that's a lot for the teachers. I think and I hope that the kids on their own start picking up on the idea of doing that. And as I mentioned earlier when I was talking about the bus, there are more opportunities to at least do the 3 feet, or the several feet. And I didn't teach little kids, but I guess like put your arm out and whatever. Yeah, so I think expectation would suffice here.
Thank you.
Hey, Cindy, I just want to make sure everybody, because there's a pending motion. I want to make sure everybody, did you call for discussion?
Yes.
I wasn't sure. Okay,
Yeah,
sorry.
the discussion is around whether to change the wording to require.
Got it. Sorry.
That's okay. Thank you. The next speaker is Jamie Michael.
We have a wonderful community. If I wear the disposable mask because of my allergies, we have a wonderful community. If we put it to the community, hey, we need masks for school. We need 3 masks for every student. We would get a response like you would not believe from the community, because it's not just the kids and the staff. We're also protecting our whole community to get this stopped so we can not have to wear masks in a year or 2. Kids are expected when they get ready for lunch, it's, stand up, line up, get your lunch card. Well, stand up, line up, get your lunch card, or put your mask on, go get your lunch card. They will do what is expected of them. And I've had a couple of friends say, oh, my kid will never wear a mask. And I'm like, okay, it's home. Make a game. Hey, we're going to see who can sit and look at each other for 2 minutes and not take the mask off, and then just keep upping it. It's parents' expectations too. If the parents have the expectation to keep their kids safe, then they'll do it. I mean, if their kid needed to wear that mask because they needed a bone marrow transplant, you'd see how fast that mask went on.
Thank you, Jamie. Mrs. Vaughn, your hand is still up. Did you have another comment? And you're muted.
Something that Jamie just said a little while ago, clarify, we're not having any kind of like salad bar or everything that the kids get will be plated and or the cafeteria workers. So there really wouldn't be kids like sneezing in the salad, or is that, am I correct on that?
That is correct. They would be a bagged lunch, or they would be in a covered box lunch. However, they might sneeze on each other, but they would not be.
Right. But yeah, there was the additional about the.
Right.
So I mean, there's that. So you don't have some child that's 2 kids ahead of you that just sneezed in the salad or something. Okay.
Right. Thank you for that clarification. Okay, and our next person is Joe Campaturo.
Are we talking with this current recommendation only about students and not the teachers? because if we change the motion to require that students wear a mask during transitions, but this doesn't apply to the adults, that could be a bad look if teachers then are not wearing masks themselves while they're leading their students who are now required to wear a mask. So I could see that being a concern where, we're not practicing what we preach if we did require for that.
Dr. Spiro and Dr. Savage, the wording does not specify students. Can you clarify the expectation there?
Could you put that back on the share screen? Is that what
Sure.
Yeah.
And the discussion right now is to change that to masks are required during class transitions.
Right, and this was brought forward, just like with Dr. Savage, because that was just for students.
For students, thank you. I thought so, but I did not want to say that without being sure. Thank you. So at this point, Joe, at this point, there has not been discussion around whether masks are required of teachers. And this particular motion does not address that. All right, I don't see any other hands. So at this time, I'm going to call for the vote. And this vote is to change the wording to say masks are required during class transitions. Yamasil Bermudez. Yamasil, I can see you.
Yeah.
Pardon?
Yes.
Yes, thank you. Marshall Bauer.
Yes.
Thank you. Joe Campachuro.
No.
Brenda Clark has dropped off the call. Kevin Daly.
Yes. Yes.
Thank you. Isaac Dozier. Mr. Dozier, are you still on the call?
Yes. Can you hear me?
Yes, I can hear you.
Okay. Sorry about that. Yes.
That's okay. Thank you. Captain Fields.
Yes.
Thank you. Marcus Goodson.
Yes.
Thank you. Brooklyn Gossett.
Yes.
Angela Haas.
Yes.
Julian Harris.
Yes.
Samantha Hauer.
Yes.
Melissa Lehner.
Yes.
Scott Lee Master.
Yes.
Jacqueline Weinberger.
Yes.
Amy Jane McWilliam.
No.
Jamie Michael.
Yes.
Harlan Parrish.
No.
Lieutenant, oh, he's not there, I'm sorry. Dr. Mary Beth Saunders.
No.
Shaniqua Smith.
Cindy, she has thumbs up again.
Thank you. Sedona Stewart.
Yes.
Betsy Vaughn.
No.
Crystal Vervat.
No. And I actually have to drop from the call, but I don't know if any other changes are going to be made with the rest of the wording to be required, but I vote no on that. And then I vote no for masks in gymnasiums, because I don't know if you meant if it's in a common area or if they're actually going to be wearing a mask when they're doing PE, but I think that's a little bit nuts. So anyways, I vote no. So,
Okay,
and I have
thank
to
you.
drop from the, yep.
Okay, thank you for staying as long as you could. Appreciate that.
Yeah. Mm-hmm.
Heather Rodriguez Wibbles.
Yes.
Thank you. Okay, let me do a quick count. We have 17 yes, 6 no. So the motion carries to change the wording to require. So now we will do a vote on the actual motion itself. Oh, first I should open that. Is there any additional comment around the motion, which now says masks are required during class transitions? And I see Jewel.
It's not so much a comment for that. I just like to ask if professional courtesy can be extended when we speak to each other. I mean, I have my opinions about things and I'm not making insulting comments about people being nuts and all this stuff. I just ask that we remain professional.
Thank you. Appreciate that. Marshall Bauer.
Yes,
Yes.
Cindy, I was just, do we have any medical expertise that has had any recommendations on this particular point?
Thank you, Marshall. Dr. Saunders or Ms. Smith, do you have any comments around this?
Hi, yes, I know it's one of those areas that we would like to be able to recommend that children place a mask on when they're transitioning, but the reality of having that mandated and being able to have that actually, occur consistently and continue throughout the full school year, I think is going to be difficult. We know that there's going to be peaks and valleys in dealing with COVID, as well as when we endure flu season. So I think a lot of the things that we're doing now, we are going to have to really come up with a seasonal plan on how we do that. But all the steps that you're already taking, social distancing, making sure your classrooms have frequent cleaning, students are separated, are all important. If you keep the movement of students going through the hallways, quickly and try and limit the times when students are going through, I think you'll be able to accomplish your goals and not necessarily have that requirement of masking during those times. So just thoughtfulness and how students are transitioning, where they're going, and then what happens during that time.
Thank you, Dr. Saunders. Okay, the next hand that I see is Amy Jane McWilliam. Ms. McWilliams, are you there?
Sorry, I thought I was unmuted. I'm just reiterating my concerns for pre-K through 5th grade, the elementary school students. I can definitely see middle school and high schoolers being able to put on their own masks during transition, even really 3rd grade and up. I think my concern is probably actually more for like the pre-K through 2nd graders, and then the teacher having to be responsible for that if the child isn't wearing a mask properly, touching of the face, that sort of thing. I think it kind of just defeats the purpose. And I'm going to vote no, and that's the reason why. I'm thinking of the younger kids there.
Thank you. Okay, seeing no additional hands, I'll call for the vote. And this vote is to require masks during class transitions. Yamasil Bermudez.
Yes.
Marshall Bauer.
No.
Joe Campachuro.
No.
Kevin Daly.
Yes. Yes.
Isaac Dozier.
Yes.
Captain Fields.
Yes.
Marcus Goodson.
Yes.
Brooklyn Gossett.
Yes.
Angela Haas.
Yes.
Julian Harris.
Yes.
Samantha Howard.
Yes.
Melissa Lehner.
Yes.
Scott Lee Master.
Yes.
Jacqueline Lineberger.
No.
Amy Jane McWilliam.
No.
Jamie Michael.
Yes.
Harlan Parrish.
No.
Mary Beth Saunders.
No.
Shay Smith. Stillwell, does she have a thumbs up or thumbs down? Can you see?
I'm looking for her name.
Thank you.
I don't see her name on here, Cindy.
Okay, so she may have had to drop off the call.
Yep.
Thank you. Sedona Stewart.
Yes.
Thank you. Betsy Vaughn.
No.
Crystal Verbat.
She had to leave the call. She said before that she had to leave the call.
Oh, that's the one that had to leave. Thank you so much. Okay, and Heather Rodriguez-Wibbles.
Yes.
Thank you. Okay, quick tally. I have 14 yes. And 7 no. So the motion carries 14-7 to require masks during class transitions. So now we have the second part of that recommendation, which was masks are expected in large spaces like cafeterias and gymnasiums. And Mr. Dozier, I want to be sure that I worded that the way you were expecting.
You got it.
Okay,
Thank you. You got it.
So do I have a motion to recommend that masks be expected in large spaces like cafeterias and gymnasiums?
So moved. Betsy Vaughn.
Thank you, Ms. Vaughn. Do we have a second?
Second.
Thank you. That was Harlan Parrish. So I will now open that for discussion. And the first hand I see is Marshall's. Marshall, you're muted. There you go.
Can you hear me now?
You're good now.
Okay, so I'm going to want to hear what the recommendation of our medical expert is on this.
Okay. Thank you, Marshall. Dr. Saunders, are you still there?
I'm sorry, what was the?
The recommendation is that masks are expected to be worn while in large spaces like cafeterias and gymnasiums.
I vote yes on expected, no on required. Thank you.
Okay, thank you. Marshall, did that answer your question? Okay, thank you. Okay, the next hand I see is Kevin Daly.
Hey there, thanks. Let me turn on my video too. So anyway, again, my kind of attitude on this with the large spaces is, I'm kind of hopeful that we're going to limit large student gatherings, like, high school, pep rallies and things like that. I mean, again, it'd be wonderful if we could have the Thursday or Friday afternoon pep rally before the big game, but, I think putting those kids in a spot like that and, maybe the elementary plays or whatever large gatherings are out there. But I really think we need to look at, what we're going to do in cafeterias anyway. Again, I know some of the elementary school teachers, especially Mr. Lemaster's there, can certainly remark on how robust his cafeteria is throughout the day. And if we're talking about a 50% reduction in capacity, I'm not sure, I'm not sure that's practically achievable. So, again, I think the reason we decided to require on buses was because we weren't able to ensure that kind of social distancing space. And so if we take that kind of rule and apply it forward to other settings, if we're not able to guarantee that social distancing that we should be, like, every medical professional says, social distance first. If you can't guarantee social distancing, then mask up, and still try to be apart from one another. I think, I think this is not necessarily out of the realm of being asked for. So anyway, that's it.
Thank you. Dr. Lemaster.
Yeah, for Dr. Savage, Dr. Spiro, whomever. Essentially what we're saying, I think, and I guess I'm just asking some clarification, students are walking to the cafeteria, they have them on. Students walk in the cafeteria, they have them on. While they're getting their lunch, they have them on. While they sit down, they move them down around their neck. Same thing around with physical education. Am I correct? Walking to, getting to phys ed. I'm looking at the elementary realm. And then, mask down once they enter the PE area. Is that correct?
That is 100% accurate. That is 100% accurate. That is to try to limit when students do have to intersect with each other. Nobody would be expected to wear a mask while doing any type of physical activity like PE or recess. This is merely during those transition times in large open spaces to mitigate. That's why we said expected, to mitigate, help to slow down any of that transmission.
Thank you. Jamie Michael.
A lot of times in the cafeteria, it is support staff that are watching the students, helping the students. And so those folks that are working in there, be very careful what I was touching and might keep my distance from the students. But I have someone that's concerned because the 1,400 students go through his cafeteria, and there's no way with the timelines that food service has to serve these kids for everybody to be in those sections that they have, and sometimes there's only 3 minutes between classes. So it is going to be difficult. I'm sure principals can think it out, figure it out, respace those tables. I'm going to rely on them to get that figured out within their cafeterias. It may be they get picnic tables and they trade off who goes and eats outside one day. Kids love that. But it is going to be a process. It is going to be a difficult process. But some of this is going to have to be decided amongst the principals and their teachers and staff.
Thank you. At this time, I do not see any additional hands for comment, so I'll make the call for the vote. And this vote is for masks are expected in large spaces like cafeterias and gymnasiums. Yamisel Bermudez.
Yes.
Thank you. Marshall Bauer.
Yes.
Thank you. Joe Campachuro.
Yes.
Kevin Daly.
Yes.
Isaac Dozier.
Yes.
Jason Fields.
Yes.
Marcus Goodson.
Yes.
Brooklyn Gossett. Brooklyn still on the phone or still on the call?
I don't see her, Cindy.
Okay, thank you. Angela Haas.
Yes.
Jolene Harris.
Yes.
Samantha Hauer.
Yes.
Melissa Lehner.
Yes.
Scott Lee Master.
Yes.
Jacqueline Lineberger.
Yes.
Amy Jane McWilliam.
Yes.
Jamie Michael.
Yes.
Harlem Parrish.
Yes.
Maribeth Saunders. I know earlier she said yes for expected and no for required. I don't see her, but I believe that's correct. Dr. Saunders, if that is incorrect, please let me know. Shay Smith, I believe, dropped off the call. Sedona Stewart.
Yes.
Thank you. Betsy Vaughn.
Yes.
Crystal Vervat. Oh, she's the one that dropped off. And Heather Rodriguez Wibbles. Ms. Wibbles, are you still on the call?
I don't see her either, Cindy.
Okay, thank you. So do a quick count. $19 yeses. I don't believe there were any no's. So it carries 19-0 for masks to be expected in large spaces like cafeterias and gymnasiums. Okay, I'm going to share my screen again to go to the next recommendation, which is around the models.
Cindy, Samantha has her hand up.
Oh, thank you, Samantha. Go ahead.
If we could we entertain a motion to also expect masks in the event of a at capacity classroom, maybe even just a secondary classroom, because I know how full those get. You know, being one of those teachers, could we entertain that as well?
Okay, let me stop sharing to go back for just a moment. Maybe I can stop sharing. What screen are you seeing right now? Do you see faces or do you see reopening?
Faces.
Oh, good. Okay. I'm seeing two different things. Thank you. Okay, so Samantha has made a motion to, would you repeat that for us so we get it clear?
Yes. So in the event that a classroom is at full capacity where I cannot provide social distancing, even within the 3 feet or more, the expectation that masks are expected to be worn there as well.
Do we have a second for that motion?
Jamie, second.
Okay, Jamie Michaels says second, and I'll open that for discussion.
Cindy,
speak to that. So in my particular classroom, I have a computer lab, and I know I'm an art teacher, but I also know that touches CTE and a lot of other teachers, and we are at capacity. Every computer is full, and I know we don't know the numbers yet, but in the event where I have a full classroom, my students are shoulder to shoulder working on same computers. So I think it would be in the best interest of the safety of my students and the teachers that they then go to for the rest of their day, that they should wear a mask in mine as well.
Okay, thank you, Samantha. The next hand I see is Kevin Daly.
hey there, sorry, didn't want to turn on the camera. I'm breaking protocol and having a little dinner too. Couldn't wait any longer. So I think again here, again, the advice of the medical professionals at this point, where we're at now, the advice of medical professionals is, social distancing, as the number one kind of idea. And then if we can't social distance, then mask up. And so, again, I think, as an expectation for now in classes where we can't socially distance, I think that the expectation that students are expected to wear masks is probably a good thing. And I think, when you explain, at least to the older ones, I think they may come along without really highlighting the expectation too much, because, they like their teachers and they don't want their teachers to get sick and they don't want their friends to get sick. And to be honest with you, I think they want to be back in school. And, if we kind of set that expectation that they wear the masks and, say, hey, listen, this is another thing we can do to kind of keep us back in school so we don't have to have a case and close the school down or spike again. I certainly think, I certainly think for now, again, given the idea that as things develop, we either, take our foot off the brake and put it on the gas or do the opposite based on the data on the ground. The governor said the other day with his own admission that the average age of new people getting it is 21. And that's not really far from, that magic age, at least in high school. And, we still don't know the long-term effects of this, for years and years of young people who might get it, and, you know, experience permanent lung damage or anything. So, you know, I just, I think it's, you know, the expectation probably is a good idea at this point.
Thank you. Next speaker is Jamie Michael.
And with Samantha having a computer class, that would be a really good idea, because even if somebody has allergies and they're sneezing, they're going to have classes come after them with those keyboards. Hopefully they will have the wipes and they will ask the students to wipe, because I know when you don't have much transition time for you to run around and do 30, 32, 36 computers, that you're not even going to be able to set up for the next class. So I think this is a really good idea for the students. I mean, the teacher can kind of social distance, still instruct. However, you have kids coming in after kids, and if it's not cleaned thoroughly, they're liable to pick it up, touch their face. And I'm an allergy person, and I'm a face toucher, so I get it. Thank you.
Thank you, Jamie. Mrs. Bond.
Yeah, I endorse the concept of what Samantha is saying. However, I think it's something we would have to work on the wording, because as it is, you know, it's very subjective to say, because a classroom that is overcrowded in one room, which might be a huge room, would be different. You know, I mean, is overcrowded 30 kids or even 20 in some rooms. So it's kind of subjective. And then the other thing is, and I don't think we have time to talk about this at this point, but there are classrooms like a computer lab. And I know there's, you know, besides just a computer lab, and I guess art, you share supplies, and the classes where you share supplies, but especially you share equipment, that's going to need some pretty special language, because, you know, and I agree with what Jamie said, that a teacher's not going to have time to wipe down a keyboard, and yet, even under the best of conditions, a keyboard or other shared equipment that might be similar, under the best of conditions, they're disgustingly dirty. I don't even want to ever take a microscope to my home keyboard. Probably none of us would. So I don't know. Dr. Spiro, do we have any, or from the health committee or from anybody, any kind of special recommendations on when you have shared equipment? And because to me, that's the huge thing, kids sneezing on the keyboards. And
actually, I'm going to let Dr. Savage weigh in on that one, because I know they put a lot of thought into how they're going to maintain those touch surface cleanings throughout the course of the day.
Thank you, Dr. Spiro. And I would say, you know, just because the example that's been talked about is actually keyboards and whatnot, I'd certainly want to make sure I don't step over Trey on that. Generally, for non-computer-based aspects of the maintenance type of cleaning, or custodians are involved, there's a significant emphasis on additional daytime cleaning of commonly touched surfaces. That's just, you know, as a preventative piece. We also have recommended moving our custodians, more of them, to the day shifts, so they can do more of that cleaning throughout the day in between student groups and transitions and so forth. But as it pertains to specific areas, I know an area that has been talked about here at great length was the keyboards and whatnot. I would definitely want to allow Trey Davis or whomever from our technology side to weigh in on that part of it.
Well, and I know it's really what Samantha was talking about. It's really two things. It's the kids being close and having them there so close, but it's also if you have back-to-back computer classes, you know, custodians won't be able to come in, and so I don't know. But my thoughts I'm kind of rambling, but my thoughts started out on maybe we need more specific language for what she was proposing, because I mean, I don't remember, what was the word you used, Samantha? Overcrowded or?
Oh, mine, the goal was if I'm not able to socially distance.
Okay, we're going to have a lot of classes like that. So I don't know. I see some things that are problematical just with the language of it. Not that I don't agree with the concept, but just with the language and being able to reasonably enforce it. So that would be my comment on it.
Thank you, Mrs. Vaughn. Our next speaker is Amy J. McWilliam.
I was just wanting to say something similar and ask a question. How many of our classrooms are currently at capacity with no ability to social distance? So I think that mask requirement would kind of be for all classes, even though Ms. Howard's example is the children sitting at computer desks. I think it would probably most likely apply to most classrooms. So I think that's something that we have to consider.
Thank you. Dr. Atkins.
Just Cindy, I'm trying to stay out of this, but I just have to say I'm a little uncomfortable that we've gone pretty far off of some of the recommendations that came forward. Originally, the intent was you had a subcommittee that really was to go in depth and then make a recommendation, and then, we yay or nay the recommendation. Now, they've been amended and changed and amended and changed, and so there's that. I do know that there's some there's concern that's come to me about the manageability of this most recent one, and then lastly, I do have concerns that some of the recommendations, when we got health officials on the line, we're going against some of the recommendations that they've been provided. So for whatever that's worth, just know that I'm getting concerned. And I know, again, this is a committee and I can take whatever recommendation back to the board, but I see this getting unmanageable real quick today.
Thank you. Thank you for those comments. I have two more hands. Mr. Daly.
Yes, ma'am. Thanks. So, and I got to be real delicate when I share this information, but I'm sure there are teachers out there who have, Jamie talked about it, and I'm going to say Jamie because she brought it up. She talked about her allergies and things like that. So I'm sure there were special considerations with the students she dealt with when she was in the classroom. I'm certain there are teachers out there who have special consideration allergies, maybe to peanuts, students with peanut allergies, where we're not allowed to bring peanuts into the school. And so, especially when we get to talking about maybe having people who might not be able to be paired up in a virtual environment, or people who have people at their house who may be susceptible, there's an argument to be made that, maybe not wearing that scent, that perfume into that one teacher's class, or bringing a peanut butter sandwich into the third grade class because somebody might die or we might have a problem, again, I don't think is unreasonable. And when we talk about cleaning, I'm just going to say it. There's very little time in transitions in high schools, and typically in secondary schools, when the bell rings, the teacher's job is to get to the door to watch the hallway, not walk around, because you go from 0 kids in a hall to 2,000 in a hall at a high school in about 45 seconds. And so, the idea that first, quite frankly, between classroom sanitizing and cleaning is not in a teacher's job description. But on top of that, if you wanted to clean the room, who's going to watch the hall? They can't be watching the hall and cleaning the room. And so, again, if we have these times where we're not able to socially distance in the classrooms, and again, I'll freely admit we don't have the numbers and we don't know, but if we have the idea that we can't do it, then again, masks are the second best option according to health professionals. Social distance, if not social distance, and then mask. And there are already examples, like I said, of of restrictions on schools and students going into certain teachers' classrooms for whatever reason. And so, you know, again, I think expectation at this point is a good idea. Again, once we've gotten the numbers and we see kind of what that looks like with the scheduling and things like that, we can always come back to any of these recommendations if they seem unmanageable. And you know, I shared my manageability kind of concerns around certain things as well today. And so, you know, I'm expected at this point seems like a good starting point, and we'll have to see what the numbers suggest and see moving, you know, forward what we can do.
Thank you. Mr. Day, and in the interest of time, I see that Jamie does have a hand up. Jamie, you've had one opportunity to speak. Do you have something that you could say in 30 seconds or less so that we can move on?
Just very quickly, students can be in control of themselves. If I went to a meeting when this started, I took wipes with me. I wiped my chair, I wiped my table. Students could have wipes as they go into those rooms and wipe their own areas.
Thank you. Okay, so I'm going to call for the vote on the motion. And Samantha, would you please restate the motion so that I'm sure we have it written correctly?
I didn't write it down, but I think it was in the event where social distancing cannot happen in a classroom, the expectations that would be masks are worn.
Okay, thank you. So you've heard her motion, and so we will now do a roll call.
Cindy, can I ask a clarifying question before we vote? Samantha, is it required or expected of what you were looking for?
Not required.
Expected. Thank you. Yamasil Bermudez.
Yes.
Thank you. Marshall Bauer. Marshall still on the call? May have dropped off. Okay. Joe Campaturo.
Yes.
Thank you. Kevin Daly.
Yes.
Isaac Dozier.
Yes.
Captain Fields.
Yes.
Marcus Goodson.
Yes.
Brooklyn Gossett. I think she's already dropped off as well. Angela Haas.
Yes.
Thank you. Jolene Harris.
Yes.
Thank you. Samantha.
Yes.
So you're going to vote. Thank you. Melissa Lehner.
Yes.
Scott Lee Master.
Yes.
Jackie Lineberger.
Yes.
Amy Jane McWilliam.
No.
Jamie Michael.
Yes.
Harlan Parrish.
Yes.
Mary Beth Saunders. Dr. Saunders, are you still there? I see the phone, but I don't see her. I think she is gone. Sharnay Smith. I'm sorry, Shay Smith. I believe she dropped off at the last one as well. Sedona Stewart.
Yes.
Betsy Vaughn.
Yes.
And Heather Rodriguez Wibbles. I believe she dropped off at the last one as well. Okay, do a quick count. I have 16 yes and 1 no, so the motion carries. That if social distancing is not able to be achieved within the classroom, then the expectation would be that masks would be worn. Thank you. Okay, so we do still need to look at our reopening models and look at that recommendation. So I'm going to share screen. Okay, so you can see that the recommendation from the subcommittee is that the district offer 4 models: the face-to-face model where students would be in the physical. Yes, ma'am.
Okay, I'm just going to tell you we couldn't see anything.
Can you see it
We
now?
can now, yes.
Okay, great, thank you. So the face-to-face model where the students would be actually in the classroom with direct instruction. The new model, the Lee Home Connect, where students would be paired with the teacher from the school. The Lee Virtual School model, which remains the same as it always had, where it's a full virtual program. And the homeschool model, where parents would actually deliver instruction at the home. Then the next piece of that would be that in the event that the face-to-face instruction were not able to be carried out due to a quarantine situation or a directive from the governor or for some other condition, then face-to-face would revert to distance learning for those students that were enrolled in the face-to-face. So do I have a motion to accept the recommendation?
This is Harlan. I move.
Thank you. Do I have a second?
I second.
Thank you, and I'll open it for discussion. Brenda Clark. Ms. Clark back on the call.
Yes, I would like to apologize for my outburst. It's pretty hard to contain my feelings when we're talking about our children and the mandates that you're proposing. I know it wasn't very professional. However, I would like to see if there's any way that I can go back and vote on anything that I missed.
Is Mr. Williams on the call as our parliamentarian?
Yes, I am. Sorry.
Could you address that question? Is it possible for her to go ahead and register her votes for items that have already been voted on?
I'm going to say no at this point. Those items have already been passed and approved. It would be equivalent if you stepped out of a meeting and the vote was taken, your vote wouldn't just simply not count. So I think she can vote with respect to any vote moving forward, but as far as those votes, that would not be applicable.
Thank you. Ms. Clark, thank you for coming back. We appreciate your coming back and joining the meeting in this discussion. Do you have any comments related to the options that are being offered in terms of the instructional models?
Can you, and I apologize for backtracking. I know it's been a long meeting, but can you give me a quick summary of what that vote is? Or
Absolutely. So the vote was to accept the recommendation that the district offer the 4 models, the first one being the face-to-face model where students are directly in the classroom, the second one being the Lee Home Connect model where students would work virtually from home, but they would be connected to a specific teacher at the specific school. The Lee Virtual School model, which is a full virtual program, which is its own school, and then the homeschool model where students would be educated at home by their parents. In the event that a class or a school or the district were to be shut down due to a quarantine or an order from the governor, then face-to-face teaching would revert to distance learning for those students. All of the other models would remain the same.
yes.
Okay, we're not to the vote yet, we're just discussion. Do you have any comments around those?
I'm sorry, no, I don't.
Okay, thank you. So our next speaker is Kevin Daly.
Okay, so as we talk about, these instructional models and Dr. Pruitt and Dr. Atkins have clearly stated this many times, but again, I think it's imperative that I bring it forward to the whole committee because I think there are a lot of people on the committee who don't have a lot of experience with kind of bargaining and contracts and things like that. So of course the instructional model is the model, it's the part of this that has the most impact on mandatory subjects of bargaining. And so, based on what happens here, the discussion goes to the board and then kind of comes to us and SPALC to kind of work out the impact of any possible changes or the models, even any of the models that we've done that don't look like things looked on March 12th, before we had to
Mm-hmm.
kind of slam the brakes on things. And so, there's still a lot of stuff for us to hash out, between Falk and the district, as far as these models. So, I just want to caution everybody on the call and in the meeting that kind of what's agreed to here and what's advanced through the school board and is not gospel, and, may very well change due to bargaining and due to other conditions on the ground. So I just feel I'd be remiss if I didn't say that, just because I don't want anybody kind of getting the wrong impression that this is exactly what's going to happen, and then possibly putting it on Facebook as gospel when that may not exactly be the case.
Thank you, Mr. Daly. And again, the recommendations from this group go forward to the superintendent, and then the superintendent, actually the final decision as to what goes forward is his decision. And in general, he takes that to his executive committee, executive team, and any further discussion. So Mr. Daly is correct. What is recommended may not be exactly what goes forward. Thank you. Okay, Amy Jane McWilliam is our next speaker.
Okay, thank you. And this might have been the 25 minutes that I missed at the beginning of the meeting, but I just want to verify the Lee Connect, that's where the child gets tethered to a teacher in the classroom. Why do that? What's going on with Lee Virtual School? I thought that we would hold their place if they opted for Lee Virtual School. It seems like we're giving them kind of almost the same option, but we're making more work for a classroom teacher.
Dr. Spiro, would you like to address that?
Sure. As we talked earlier, this was an additional option for families to try to stay connected to their school. So actually what we'd be doing is we'd be in elementary, would be identifying teachers whose sole job it would be to teach virtually for parents that decide to stay home with their students. So that would be, it's an additional option for them. And then high school, as we said earlier, and I believe we already approved the Lee Home Connect, what would we be doing through 6th through 12th grade? We would be pairing students up with teachers. That way, when they're ready to come back face-to-face, they would go right back to those teachers' classes. So they already were aware of what those procedures were, where they were with content. They already were familiar with the teacher and the school as well. So it's just trying to keep students connected to school as an additional option. You are correct. If students that are enrolling in Lee Virtual School, they are guaranteed the spot back at their school for those students. So it's just something else for families.
Thank you. And one additional differentiation there is that students who are in the Lee Home Connect would have the option of moving back to the regular classroom at the quarter, whereas students in the Lee Virtual would have that option at the semester.
Okay, thank you for taking the time to explain it to me. And the teachers that would be teaching the Lee Home Connect, those teachers would be teachers that need to teach from home for one reason or another. Is that what you said, or did I understand that incorrectly?
Correct. I think it was Dr. Pruitt, and we're talking with the Human Resources Department. They would first start with those teachers that were considered to be vulnerable employees. We want to make sure we try to keep everybody employed as much as possible. So that would be those teachers that would be taking on that responsibility.
Okay, thank you so much. That makes it more clear. Thank you.
Thank you. Okay, I do not see any additional, I do see another hand. Mrs. Vaughn.
Now, I also wanted to clarify the Lee Home Connect. They're doing real time, or are they not? They have to, if they have a first period class from 8 to 9:20, they would be logged in at that time, right?
You are correct, Ms. Vaughn.
And that's really a huge difference. Just the way Florida Virtual, they do modules, and it's real different. And I think the other thing is at, for instance, if you're in an advanced class, AP or ACE or IB, and you didn't want to be face-to-face, you would still be able to have that course offering, right?
Yes, Ms. Vaughn. Yes.
Okay. So I think that's really, really important. If this goes to Dr. Atkins and is recommended, and then if the school board approves that, I think that's really a very, very important differentiation. First of all, the real time, and I can tell you there are kids like my grandson who wants to have, and he's going into 8th grade, he wants to have that connection with the teacher. And then the other thing, the unique classes and the advanced classes that we offer that wouldn't be available to kids in the virtual. So I think everybody should understand that.
Thank you. Thank you for those clarifications. Okay, I see no further hands, so I will call for the vote on the recommendation that the 4 different instructional models that will be offered this fall would be the face-to-face model, the Lee Home Connect, Lee Virtual School, and the homeschool option. In conjunction with that, if there were an order to close a school, a classroom, the district, then face-to-face model would revert to a virtual model. We've already had the motion, so we're going to do the vote. Yamasil Bermudez.
Yes.
Thank you. Marshall Bauer. I believe he dropped off at the last one. Joe Campaturo.
Yes.
Brenda Clark.
Yes.
Kevin Daly.
Yes.
Isaac Dozier. Mr. Dozier still with us?
Yes, my answer is yes. I'm sorry. I had it on mute.
Thank you. Captain Jason Fields.
Yes.
Marcus Goodson.
Yes.
Thank you, Mr. Goodson. Brooklyn Gossett. I believe she dropped off at the last one as well. Angela Haas.
Yes.
Julian Harris.
Yes.
Samantha Howard.
Yes.
Melissa Lehner.
Yes.
Scott Lemaster.
Yes.
Jacqueline Lineberger.
Yes.
Amy J. McWilliam.
Yes.
Jamie Michael.
Yes.
Harlan Parrish.
Yes.
Sedona Stewart.
Yes.
Thank you. Betsy Vaughn.
Yes.
Heather Rodriguez Williams. Oh, she had dropped off. Okay. So I'm not going to go back and count because it was a unanimous vote. Thank you very much. I'm going to go back to sharing screen at this time so that we can talk about our next steps. Okay, is the screen up at this time? Not yet.
Not
Not yet. Now it is.
Yeah.
Thank you. Okay, so as we move into our next actions, the first thing that's going to happen is a board workshop tomorrow afternoon at 1 p.m. It will be streamed live on YouTube, so please join in. And your recommendations will go forward to the superintendent. He will look at those, and then we'll move forward. Pardon? I'm not sure if that was a question. And those, then he will bring recommendations forward to the school board. On Thursday, there will be a news conference at 3 p.m. in the boardroom. Social distancing will be in place. And then the following week, we will have a survey out to our parents, which will provide the options of the instructional models and ask them to make a selection as to how they would like their child to be instructed for the fall semester, when school begins. I will say that. When school begins, what option would they like to choose? So I'll open it up for quick questions or good of the order. Seeing none, Mrs. Vaughn, do you have any final statements? Thank you. Dr. Atkins, do you have final comments?
I'm deeply, deeply appreciative of the actions of this committee. You can see that people feel very passionately about these issues. There was good, vigorous debate, and I think that I believe everybody that participated really tried to put out there what they thought was in the best interest of the children of Lee County and our community. So I really do appreciate this. This is a very, very difficult decision. Many decisions actually that we have to make moving forward. So I appreciate you guys taking the extra time. Not just on this call, we went more than an hour long, but also the times that you spent in subcommittees and on previous meetings. We may have the need to call you back because, again, we have seen this is a very fluid situation, but I do think we have some really good, strong recommendations for our school board tomorrow. And so I can't say I can't say enough how much I appreciate you guys taking the time to do this. So thank you.
Thank you, Dr. Atkins. So if you have plus deltas, if you would please leave those in the chat, we would appreciate that. And I add my thanks to those of Dr. Atkins and Mrs. Vaughn. I appreciate your patience, and we look forward to seeing you again soon. Thank you. Good night.